Good afternoon, everyone. Welcome to the Committee on Women and Gender Equity. At this time, would everyone please place their electronic devices on vibrate or silent? If you have testimony, please send it to testimony@council.nyc.gov. That is testimony@council.nyc.gov. Thank you. Chair, we're ready to begin.
Thank you. Good afternoon, everyone. First of all, apologies for the delay in the start. Appreciate y'all's patience. My name is Tiffany Caban. My pronouns are she, her, and I'm the chair of the Committee on Women and Gender Equity. And today, the committee will be holding an oversight hearing on reproductive rights and hearing 5 bills and 5 resolutions covering a range of issues pertaining to reproductive health. So we have Intro 458, sponsored by Speaker Adams, related to requiring the Department of Health and Mental Hygiene to maintain language access for service abortion providers. 2 bills sponsored by myself that I'll talk about briefly later, Intros 465 and 466. Intro 475, sponsored by Councilmember Shahana Hanif, and co-prime, sponsored by myself, the public advocate, Councilmembers Farrah Lewis, Carlina Rivera, Crystal Hudson, Amanda Farias, related to creating a private right of action related to interference with medical care. Intro 507, sponsored by members Rivera, Gutierrez, Joseph, related to requiring DOH-MH to make miprostone and misoprostol, commonly referred to as the abortion pills, available free of charge at its health centers, health stations, health clinics, and other health facilities, as well as Rezo's 195, sponsored by members Brewer and Menon, a Rezo calling upon New York State Ledge to pass and the governor to sign the Reproductive Freedom and Equity Program, which would establish a grant program to provide funding to New York abortion providers and nonprofit organizations to increase access to abortion care. Rezo 196, sponsored by Councilmember Brooks Powers, calling upon New York State Legislature to pass and the governor to sign Senate Bill 9137, the Assembly Side 10357, which would allow out-of-state physicians to provide reproductive health services in the state while awaiting full licensure. Rezo 197, sponsored by myself and Councilmember Velasquez, the public advocate, members Hudson, a resolution declaring New York City a safe city for all those in need of abortion-related care. Rezo 200, sponsored by Councilmember Menon, Rezo declaring January 22nd, 2023 as Roe v. Wade Day in the city of New York to commemorate the 50th anniversary of the landmark United States Supreme Court decision. And Rezo number 245, sponsored by the public advocate, calling on the United States Senate to pass and the president to sign the Women's Health Protection Act and other topics. Now, I think that we do ourselves a disservice if we don't place the Dobbs decision within the larger context of our constitutional crisis, our current crisis of democracy as well. You know, even before the far right wing used a mix of perjury and dirty tricks, quite frankly, to hijack and pack its majority with a far right-wing fundamentalist ideologues, the Supreme Court already had all the makings of an illegitimate anti-democratic institution. It is a body of unelected, robed scholars with lifetime appointments, predicated on their special insights into the intentions of long-dead slave-holding patriarchs. It doesn't make much sense. And in hindsight, it should not be surprising that it has become a quasi-theocratic tribunal. And we have been fed this fallacy that the judiciary is some apolitical institution. And not ironically, very unironically, it's exactly because I was a practicing attorney who litigated our constitutional rights in court every day that I know the courts and the judges who preside over them are just as inherently political as the other 2 branches of government. And it's with that knowledge that we can then say, enough deference to this collection of religious fundamentalists and corporate extremists, enough talk about how the court serves as a check on the legislative and executive branches. We talk about that a lot. We talk about how the legislative and executive branches check each other. And it's time to start talking about how those branches can, should, and must check the court. It is the one part of the relationship that we actually aren't engaging with. You know, the extremist majority's indefensible decision to overturn Roe v. Wade is a searing affront to human rights. It's a precursor to immense death and suffering, and it's a call for us to get organized. I'm proud to say that so many of my colleagues have risen to the occasion and crafted a wide array of legislation to counteract this attack on all people who can get pregnant. And I am, of course, especially proud of the legislation I introduced as part of this wave. My team calls it the Safe City legislative package because its focus is really on ensuring that New York City is a safe city for all those in need of abortion-related care. We wanted not just to make a clear declaration of where the city stands, but also to back it up by policy. And then we wanted that policy backed up by data. And so that's why it exists in 3 parts. It's 1, that first resolution officially declaring New York City a safe city for all those in need of abortion-related care. 2, a law prohibiting the city from detaining or cooperating with any person or agency anywhere else trying to detain someone for the provision of or aid in obtaining a lawful abortion performed here. And then 3rd, lastly, a law requiring DOHMH to work with the diverse advocates and experts to produce a yearly report assessing our city's capacity to accommodate the increase in reproductive health care services and recommending steps to bridge any gaps that it ends up finding. And so I want to be clear about a few things. I want to be clear that this is not just about cis women, but anyone who can get pregnant. I want to be clear that abortion is not just a way to mitigate the harm of rape or incest, but is rather a safe healthcare procedure for a number of medical conditions, including ectopic pregnancy. And I want to be clear that in this new era in the fight over reproductive justice, it is going to take an immense groundswell of action to get what we really need. Our demand is the guaranteed right to a safe, legal abortion on demand, without apology, and at no dollar cost for anyone who determines that they need one. We will enjoy only the rights that we can secure for ourselves. It has become abundantly clear that it's going to take more than permitted marches and clever, pithy signs. It's going to take more than just voting or donating to candidates. It's going to take courageous action and a determination to confront power with righteousness, with solidarity, and luminous hope that pierces through the pervasive gloom of oppression. And so on the way there, we must do our part to guarantee New York as a safe city, not just for our own residents, but for our neighbors elsewhere as well. And I think that this package of legislation is a testament to our commitment to doing just that. And before moving on, I'd like to pause for remarks from some of my colleagues who are sponsoring legislation and have joined us today. I also very quickly want to acknowledge the committee members who are present as well. We have council members Hanif, Brewer, Rivera, Gutierrez, and I will start by handing it over to Councilmember Rivera for some brief remarks.
Thank you so much. Today I stand in proud, relentless, and unforgiving solidarity with my colleagues in the Women's Caucus, in the city's first women majority council to defend reproductive care access for all people. Every person has the fundamental human right to determine their future with privacy, dignity, and autonomy. Access to a range of healthcare choices underpins not only reproductive freedom, but reproductive justice. Research has established medication abortion as both highly effective and exceptionally safe. It has fewer risks than Tylenol. It is also common. In 2020, more than half of abortions in the United States were medication abortions. Despite this, so far this year, some form of restriction on medication abortion has been introduced in 22 state legislatures, and that number will likely rise. My bill, Intro 507, will require every city-run healthcare clinic to provide access to the abortion pill free of cost. Intro 507 will not only strengthen New Yorkers' access to medication abortion care, but would also ensure our city is ready for the inevitable rise in demand for abortion care nationwide. New York has always been a safe haven for all who sought abortion care. As legislators and as the representatives serving New Yorkers, we must uphold that legacy. I urge you all in supporting me in this legislation and the bills being heard today, and I want to thank Speaker Adams for her leadership. I want to thank Chair Caban for her leadership as well in defense of reproductive justice for all. Thank you.
Thank you. And I also want to acknowledge the presence of Council Members Brooks Powers and Councilmember Riley, who has joined us virtually, and pass it over to Councilmember Hanif for remarks.
Thank you, Chair Caban. Hi, everybody. I'm Councilmember Shahana Hanif, and I represent the 39th District in Brooklyn. Thank you to the Committee on Women and Gender Equity for holding this essential hearing and for including my bill, Intro 475, on today's agenda. I want to express gratitude to the co-prime sponsors who introduced this bill alongside me, Chair Caban, Public Advocate Williams, Council Members Lewis, Rivera, Hudson, and Farias. I also want to thank all of the other council members, including Speaker Adams, for bringing us to 22 sponsors on this bill. Finally, I want to thank the thousands of everyday New Yorkers who have taken to the streets over the past week to support abortion rights in response to our illegitimate Supreme Court's despicable decision to overturn Roe v. Wade. Your voices are powerful and absolutely necessary during this difficult moment. As we know, this decision will result in severe restrictions or bans on abortion in states governed by conservatives. This will in turn mean that many people seeking abortions will be traveling to our city, given our strong protections around reproductive rights. Even prior to this decision, the percentage of New York abortion patients who are out of state has increased from 4% in 2009 to 9% in 2019, according to the Centers for Disease Control. This number will inevitably spike in the coming months and years. Thankfully, our providers are stepping up to meet the demand. Planned Parenthood of Greater New York has already increased its capacity for appointments by 20%. And we are working closely with our colleagues to secure council funding to provide practical support, such as travel, lodging, and childcare for those coming to New York for abortions. However, despite support from the city, these folks are vulnerable to being subject to civil suits for accessing care that is legal in New York City, but illegal in their home state or municipality. For example, an abusive partner or the executive director of a quote-unquote pro-life group could sue someone from, say, Missouri, who comes to this city to receive an abortion. Intro 475 addresses this issue by first establishing these suits as interference with medical care, an appropriate designation given that these suits intimidate and dissuade people from obtaining care that is legal in New York City. Notably, this would also apply to trans-affirming care in addition to reproductive care. Second, it establishes a right to private action around interferences with medical care, allowing people to countersue for damages under New York City law. This right to private action has important legal precedent in Connecticut and New York state law. If passed, this bill would cement New York City as a sanctuary for abortion rights. It would be a statement to people saying, our doors are open, we will provide you with the care you choose, and we will do everything we can to protect you from those who try to get in your way to receive care. Thank you, and I look forward to hearing from the administration, my colleagues, and the public.
Thank you, and then finally, brief remarks from Councilmember Brewer.
Thank you very much, Chair Caban, and I'm here on behalf of Resolution 195. It calls upon the state legislature to pass and the governor to sign the Reproductive Freedom and Equity Program, and I think Senator Cordell Clear and Assemblymember Jessica Gonzalez Rojas are the sponsors. It's just unfortunate that we're here in 2022 having to deal with all of this, and that the other night I was at an event. I don't even want to say which provider because I'm afraid of even mentioning names. And there were volunteers and they were doing great things. And a woman had just arrived from Oklahoma. She was very early in her pregnancy. And if she had told anybody in Oklahoma that she had come to New York for an abortion, she would have been arrested when she returned. So to the credit of these amazing doctors who are performing abortions, they said she had a miscarriage and she went back to Oklahoma. That is what we have to do in 2022. It's horrible, thanks to the Supreme Court. So this Reproductive Freedom and Equity Program would support access to abortion for low-income New Yorkers and provide financial support for the many women coming to New York who will from states that ban abortion. We know that in 2019, 7,000 abortion procedures in our state were from women coming from other places in the United States. I assume that the number will increase. We don't know how many, maybe 32,000 a year. That's a guess from the Gottmacher Institute, which has been doing this work for a very long time. We know that 22 states have laws or constitutional amendments to ban abortion on the books, and 4 states will ban abortion without the existing federal protection. So we know that this program is important. It would provide funding for uncompensated abortion care regardless of a patient's health insurance status or ability to pay for care. Nonprofit organizations would receive grants to help people from out of state seeking abortion services in New York. And the legislation prohibits the state from tracking patients' personal information through providers that receive funds from the public program to protect patient privacy, and many, many organizations support this. I again say, having spent about 40 years going to rallies and advocating for this right, the fact that we have to do this today is abhorrent, but I look forward to working with my colleagues to make the best of what we have to deal with. Thank you very much.
Thank you. Finally, I just want to thank my staff, including Steph Silkowski, my chief of staff, and Madhuri Shukla, my legislative director, and committee staff for their work in preparing this hearing and working on the legislation, including Brenda McKinney, committee counsel, Anastasia Zamina, legislative policy analyst, and Aisha Wright, finance unit head. And now I'm just going to turn it over to the committee counsel to administer the oath.
Hi, thank you so much for joining us today. Can you please raise your right hand? Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions?
I do.
Thank you. And sorry, can you say yes for the record, for both of you?
Yes.
Thank you so much. And you may begin your testimony when ready.
Thank you. Good morning, Chair Caban and members of the committee. My name is Laura Lewison. I'm the Assistant Commissioner for the Bureau of Maternal, Infant, and Reproductive Health at the New York City Department of Health and Mental Hygiene. I am joined today by my colleague, Dr. Tara Stein, the Medical Director for our Bureau of Maternal, Infant, and Reproductive Health. On behalf of the administration, we thank you for the opportunity to speak today on the critical, timely, and historic topics of abortion access and reproductive health. As we are all painfully aware, the Supreme Court overturned Roe v. Wade a week ago today, and with it, the U.S. constitutional right to a safe abortion, a right that was in place for half a century. Over half of all U.S. states are expected to restrict or fully prohibit abortions now that Roe is overturned. New York State has become one of the few states where pregnant people can seek safe, legally protected abortions. I want everyone to hear me say this loud and clear. Abortion is still legal in New York State, and this city is and will remain a safe haven for people who need an abortion. Abortion is health care, and access to abortion is a public health issue. Abortion is a safe, common healthcare procedure. 1 in 4 women in the United States will have an abortion by the age of 45. The evidence is very clear. People are hurt when they do not have access to abortions. When someone is forced to continue a pregnancy against their wishes, they are also forced to take on the risks of pregnancy and labor. Those risks are more significant for some communities. For example, as the Council is acutely aware, the United States has the highest maternal mortality rate among developed countries, with a terrible preventable disparity in maternal mortality and morbidity for Black women. Overturning Roe will have foreseeable consequences in increasing the risk of death or significant illness for people across the country. Limiting access to abortions also has negative consequences for people's long-term economic well-being and safety. Patients who do not obtain an abortion when they want one are 4 times more likely to live in poverty afterwards and experience long-lasting effects on their educational attainment and job opportunities. Ensuring safe, legal access to abortion care is a public health necessity. Without access to abortions, Americans' health and well-being will be severely harmed. And although most Americans support safe and legal access to abortion, the minority opinion has prevailed over evidence, science, and public opinion. Nearly 50 years of escalating anti-abortion campaigns and policies set the stage for the situation we are in today. Thus, it is on us, the localities and states that continue to guarantee access to safe and legal abortion services, to take on the operational, emotional, and fiscal responsibility of providing it for the rest of the country. We should not have to do that, but we absolutely will. We will do so because we are committed as a city to ensuring sexual and reproductive justice for all New Yorkers and for those who travel to our city seeking refuge. Sexual and reproductive justice exists when all people have the power and resources to make healthy decisions about their bodies, sexuality, and reproduction. And our commitment to maintaining New York City as a safe haven for abortion access stems from our deeply held belief that all people have the right to choose to have or not have children and control their own bodies. We are prepared and committed to improving access to abortion for New Yorkers as well as any people who travel to our city to get a safe abortion. As the city announced last week, we have updated and enhanced our public websites and 311 to provide clear and accurate information about abortion services. And we are standing up a citywide abortion call line and navigation hub, so information will be centralized and easily accessible. We will also be increasing provider capacity and will add medication abortion at our sexual health clinics. Information about abortion services in New York City is available on our website, nyc.gov/abortion. And while we are committed to maintaining New York City as a safe haven for abortion access for all people, we must acknowledge that this country, including New York City, still has a long way to go in guaranteeing equitable access to reproductive health care services for all. Our nation and city's shameful, long-standing history of structural racism hangs over our systems of care. The people most affected by limiting abortion access are those who have been excluded and marginalized through individual discrimination and systemic barriers. This includes Black, Indigenous, and other people of color, people with disabilities, LGBTQ+ people, people with low incomes, and young people. The ongoing work of the city, including at the health department and at NYC Health and Hospitals, in conjunction with the council's robust package of bills being heard today, will help facilitate equitable access for all New Yorkers and for those traveling to New York for safe abortions and other reproductive health care services. Our work will prioritize ensuring that all communities can afford and obtain the high-quality sexual and reproductive health care services they need. Our current work in reproductive health demonstrates our ability to achieve impact. The historic decline in adolescent pregnancy rates over the past decade is just one example of the health department's record of success. We want to thank Council for this historic package of reproductive health bills. The administration supports the goals of Introductions 458, 465, 466, 475, and 507. It is essential that the city do everything within its power to protect the rights of people to get abortions in this city and ensure access to sexual and reproductive health care services. We look forward to discussing the specifics of each bill after the hearing and continuing these conversations with Council to ensure our mutual goals are met to best serve New Yorkers at this pivotal moment in history. We know your work does not end here. In closing, I want to reflect on this moment in time for those of us who work in, advocate for, and amplify public health. To work in public health is to dedicate your life to preventing morbidity, mortality, and disparities in health outcomes. We go to work every day to save and improve lives, to ensure communities are protected from deadly diseases now and in the future, and to build on evidence with which decision makers can execute policies and programs to further enhance health and well-being. The Supreme Court's decision aims to do precisely the opposite. In this historic moment, we have a moral imperative to uphold the rights of all people to have access to safe, affordable health care, which includes abortions. The Department of Health is prepared to lead that work. Why? Because it is our job. We place the sanctity of the health, dignity, and well-being of those we serve above all else. We do this standing on the shoulders of those who came before us, hand in hand with those who are here with us now, and for the millions who will come after. Thank you for this opportunity to testify, and we look forward to taking your questions.
Thank you very much. I just want to, let my colleagues know if you have questions, please flag for myself or Brenda, and we'll dive right in. Okay, so I want to start by, again, thanking you for being here. It's obviously a very important topic that we're here to discuss and explore, and start with kind of general and then narrow in scope. In terms of abortion access and the recent Dobbs decision, the Reproductive Health Act essentially codified Roe v. Wade into law, making it clear that abortion is legal in New York State under 3 circumstances. 1, the abortion occurs before the end of the 24th week of pregnancy. 2, the abortion is, quote, necessary to protect the patient's life or health. And 3, there is an absence of, quote, fetal viability or the ability for the fetus to survive outside the womb. However, given that the U.S. Supreme Court overturned Roe v. Wade with last week's Dobbs v. Jackson decision, what major risks still remain for birthing folks in New York State? And specifically, what do you see as the immediate effects of the Dobbs decision on New York City? Will this affect care? And what is the biggest barrier to ensuring that all people in New York City have access to safe and affordable sexual and reproductive health care?
Thank you for your question, Chair. I want to emphasize and reiterate that abortion is still legal in New York, as you're pointing out, even now that Roe is overturned. Abortion services are protected by law in our state, and you are correct, we do anticipate that there may be increased demand for services in our city and in our state following the decision. We have been actively preparing for this for the past 2 months with national and local partners, including our colleagues at New York City Health and Hospitals, private healthcare facilities, as well as community-based organizations and advocates. And we are working to protect existing access by ensuring that New Yorkers and those who travel to our state can access care by providing accurate information to the public and providers and supporting expansion of services in collaboration with our local and national partners.
Thank you. And how is the city more specifically preparing for not even potential, the anticipated influx of patients seeking reproductive health care?
Thank you. So we are very excited to stand with the mayor in expanding access to services by offering medication abortion at our sexual health clinics, and by ensuring that the public and providers have accurate and current information about services, both how and where to obtain services, how to pay for them, and how to ensure that we are supporting costs associated with those services like childcare and transportation. We will be, as I mentioned in my testimony, standing up a navigation center to ensure that people understand where and how to get care.
How are those communications being made? You said you're informing the public of these things.
Yeah, thank you for your question. It's really critical, right? People can't get services that they don't know where or how to find information about. We have updated our website to ensure that it has the most up-to-date and relevant information about where to get care, and we really appreciate council's support in ensuring that the public knows that that is a strong, accurate, informed resource. And we've also updated scripts with 311 to make sure that callers have the same information.
And is there language accessibility and incorporated into those updates?
That's a great question. Yes, we are committed to ensuring that all New Yorkers and all people who travel to our city have access to that information regardless of what language they prefer to speak. And our website has a button for translation, and we make our materials available usually in at least 13 languages.
Great. And since you mentioned the website, I want to ask more specifically about that. Can you describe any changes or interesting notes of web traffic to DOHMH's website since the decision was announced? And obviously, while it's very early at this point to tell, have there been any significant changes in the way New Yorkers are engaging with DOHMH? And then if so, like, how has the city responded to any such changes, and how can the city have a stronger impact on gender equity on that front?
Thank you, Council Member. That is a great question. We are excited that our website continues to serve as a reliable resource, a trusted resource for all New Yorkers. I'm going to pass this question to my colleague, Dr. Tara Stein, to provide more specifics about our website traffic.
Thank you so much, Chairperson, for the important question. And we are monitoring the traffic to our website, and we have noticed spikes in activity, both when the original Dobbs decision was leaked a few months ago, and then when the final decision was made, we saw big upticks in access to our website. So we do know that the people of New York are coming to our website and rely on the Department of Health and Mental Hygiene as a source of important information. And we have been diligently working to make sure that all information on the website is as up to date and accurate medically and in terms of access for services as possible, and we will continue to do so.
Great, thank you. Can you, in relation to the Health and Reproductive Initiative, can you provide any updates on the Commission on Gender Equity's Health and Reproductive Initiative, especially regarding any developments with the decision and since the onset of the COVID-19 pandemic?
Thank you, Chair. We work closely with our sister agency, the Commission on Gender Equity, but I'm sorry to say that they are not here today and we cannot speak to that.
Okay. And what are the biggest barriers facing, both cisgender and transgender folks of color particularly, as well as people who are non-binary or gender non-conforming in accessing sexual and reproductive health resources in New York City? And in what ways is the city working to address those specific barriers?
Thank you for your question. So I want to reiterate first and foremost that abortion is legal in New York. New York City will continue to be a safe haven, but that does not mean, as you're noting, that all people in New York City or New York State have equal access to the health care that they need. And we use data to better understand disparities at the health department across all populations, and we use that data to inform where and how we provide services.
And again, I want to push a little bit on getting those details, right? Because if we're going to be successful in our attempts to reaching the folks that have the hardest time getting access, like, what particularly are we doing, and in what way? Like, I think we can't reach them unless we are accurately identifying exactly what keeps folks from being reached in the first place. And so again, particularly cis and transgender folks of color and non-binary and gender non-conforming. Like, I've heard overarching sort of generalities about the outreach that's being done, but I'd love to hear an articulation of the understanding of what folks who live that experience are facing, what's keeping them from being able to get help, and then what's being done.
That's a great question. So we know that a significant barrier to accessing care is the ability to pay for care. And that is true. The majority of people who get abortions are low income and struggle to make both pay for care and pay for the costs that we know are associated with that care, like childcare, transportation, to make up for lost wages. Those costs are significant and have a real impact on people's ability to access resources. I'm also going to turn to my colleague, Dr. Stein, to talk a little bit more about some of the specifics that we know are also critical in reaching different populations.
Yeah, and to add to that question a little bit, I'd also love to hear about the efforts that the administration is making to make sure that there's cultural competency, right? Like that are those particular communities feel safe in coming for that help.
Thank you so much. And I want to reiterate what my colleague has emphasized already, is that we know that people of all genders do seek out care for reproductive health and abortions, and it's really important to center everyone who might need an abortion in the conversation, including people of all genders, allows us to destigmatize both abortion care and advance health equity for everyone. And so it is really important that we are conscious of our language. And we do work really hard at the Department of Health to make sure that our language is inclusive of all people who might seek out care. And we recognize there are times when we might need to use terms like women when we're referring to data that's publicly collected. And there are times when we can be more inclusive in our statements, and we really are thoughtful about that. And we work with our colleagues and our partners who do service care, like health and hospitals and CBOs who provide care to patients, to provide opportunities to increase the expansion of non-gendered language when it comes to patient information, materials, talking about reproductive health and abortion access.
And you touched on I want to go back to the language access piece for a second. You touched on the availability online, but can you describe what you're doing to cross the digital divide and reach folks who don't have access to Wi-Fi and are also at the intersection of maybe having limited English proficiency?
Yeah, I'd be happy to speak to that. So we know that 311 is a trusted resource for all New Yorkers, and that can serve as an important tool in reaching communities that don't have digital access, as you're describing. We are also working actively at the department to stand up a communications campaign that will provide accurate information to everyone about abortion care that will be widely accessible and not reliant on people's access to computer, Wi-Fi, data plans.
I'd love if you could keep us apprised of what that communications campaign looks like and how the council can help facilitate the execution of a campaign like that.
We would love to stand with council and share the information and work with you in order to disseminate that, yes.
And what do you all see as some of the barriers to people who are traveling to New York from other states where now abortion is illegal and are seeking care here?
That's a great question. So to ensure access to abortion services for those who travel to our city, we've identified a number of different very critical aspects of that access. First, we need to ensure that everyone has accurate information about how and where to access care in New York and how to pay for abortion care. We also know that people need to feel safe when accessing those services. We have seen increasing protests throughout the city outside of our healthcare centers that provide abortion. And so it is critical that we work in collaboration with NYPD to ensure that patients and providers, and that goes for patients who are New Yorkers and patients who are traveling here who may feel an additional level of intimidation and fear, very real fear, that they feel safe in accessing facilities without intimidation or harassment.
And forgive me, because I guess I'm not quite sure I understand or am making the connection. What is the role of the NYPD in addressing the barriers folks traveling across state lines seeking care?
Yeah, apologies, let me clarify. One of our concerns, one of the things we're paying attention to is people's physical safety when accessing abortion care at healthcare providers. We have seen increased protest activity at healthcare providers that offer abortion services. And we know that that is a significant deterrent and an incredibly intimidating factor when trying to access abortion care. That's true for New Yorkers, but it's also very true for people who may be traveling from out of state, where they have additional fears about the penalties and potential criminalization of abortion upon returning home. So we want to make sure that we are ensuring safe access to clinics.
Well, and what's being done to account for the fact that there's plenty of the population that actually the sight of an increased police presence would be chilling. Again, when we talk about who is most disproportionately affected by this decision, it is communities of color, it is queer, trans, and gender nonconforming folks who historically, for very good reason, do not find safety in police presence. So, what is the other infrastructure that is available that makes it a safe environment for folks to go access the care that they need?
Yeah, I really appreciate that question and understand your concern. We are actively talking, we are in very close communication with our colleagues, both at health and hospitals and the private healthcare facilities, about this concern, and definitely can include that element in our conversations. It's something folks are already talking about and aware of, and we're happy to circle back with council with more information about that after the hearing.
Yeah, I would love to hear follow-up on that. I mean, we are seeing also, like, in the streets, as people are protesting, that the very people who are trying to access this care, the very people who are putting their bodies on the line to protect the ability for other folks to access, are experiencing state violence in the process. And so, you know, having them also be the stewards of creating a safe environment for folks, I just want to flag that that is, that poses a very potential, you know, a problem that needs to be accounted for. Yeah. Who's got questions? Oh, everybody. Okay. All right. I'm going to take a break from asking some questions to provide some space and time for my colleagues, and I'm going to hand it over to Councilmember Gutierrez.
That was so fast. Thank you so much. Thank you so much for your testimony, and thank you to Chair Caban for her leadership. So I just want to dig in a little bit more on the 311 component. We had an extensive marathon of a hearing yesterday, joint hearing, where I think we really uncovered a lot of how 311 is a vital tool, but also a lot of the shortcomings. And when we're talking about language access and just accessibility as a whole, it's certainly with a lot of faults. So primarily is the interpretation piece. Now they use a language line, which I believe so does the Department of Health, right? Most city agencies use language line as an interpreter service. Is that correct? Are you aware if DOH, MH uses language line as the same vendor?
I don't have the information about that right here, but I can certainly get back to you on it.
Okay, I think, yes, certainly let us know, but I think that's what they shared yesterday. So some of the issues that, you know, New Yorkers have when they're seeking interpretation services is that they will be put on hold in English. They'll be told that there's an interpreter coming in, so we were trying to hone in on what that lag time is, the interpretation back. So I think that is a key piece that I would love to help along with my colleagues in ensuring that the feedback that we got from 311, is like, we could be better. And I think with something as vital as abortion services and access to healthcare, it's something that I think collaboratively we really need to push on, and so happy to brainstorm there. The other piece that I wanted to also say is that 311, their text services currently is only in English, and something that we've been seeing for a lot of folks, especially in our immigrant communities, is like texting is a viable option, right? They're piloting a WhatsApp program to try to get communication. So I think hearing from you on how important you think this would be in as outreach and engaging with people, I think would be super helpful. That way we can carry that and working collaboratively to push 311 to expedite that, because I think that that's going to be really important. I have two questions. One is, sorry, that was so fast. Oh, you were going to confirm the language line, sorry. The other question that I wanted to ask was, are you working with other agencies or thinking about working with other agencies for folks coming in out of state and providing legal services or temporary shelter services? Is that something that you think is going to come up? And like, what does what do those conversations look like?
Thank you, Council Member. And yes, we agree with you that people traveling to New York City from out of state will need additional support, right? Nobody comes to New York City free of cost. And we have been planning with our local partners as well as national partners who work on exactly the issue you're describing, how to ensure that people get somewhere safely, that they have support when they get there, somewhere to stay. We've been planning with them since the leaked decision, and we are in very close communication with them still to ensure that we are developing a strategy and really aware of the full landscape of what is possible in supporting people who travel here for care.
Sorry, to your knowledge, for anybody who is calling 311 or is calling to get information about a crisis pregnancy center, a fake abortion clinic, is the best pathway for them to file a complaint 311?
Thank you for your question, and we share your concern that people have accurate information about healthcare, including abortion. We know that crisis pregnancy centers are really better called fake clinics because they disseminate misinformation and intentionally mislead pregnant people with fear-based messaging to stop them from getting abortions. We have information on our website and have updated the 311 script about how to report a crisis pregnancy center who may be violating that. And I can turn to my colleague, Dr. Terestein, if you have any more information about that.
Thank you so much. Yeah, we are very conscious and concerned about the potential for misdirection and misinformation that these crisis pregnancy centers are creating, and the delays and diversions that prevent people from accessing the care that they want. And we are working closely to make sure that people have the most accurate information on how to report a crisis pregnancy center through our website and through the 311. If they believe someone is misrepresenting, we encourage people to call 311 to report a crisis pregnancy center.
Thank you. I'm not going to ask any more questions, but I would love to follow up with you to make sure that 311 is streamlining that as efficiently and it's going to where it needs to go to. Thank you so much.
Thank you. I mean, if you've got a couple more, I can come back to you. Yeah? All right. Councilmember Hanif.
Thank you for testifying. Could you share any concerns that you all are thinking about in regards to my bill, Intro 475? Thanks for sharing just broad support of the suite of legislation introduced, but would love to hear a little bit more about your thoughts.
Thank you, Councilmember. We fully support this bill and are looking forward to the implementation process. We support it as written. We believe that providers should be protected from interference with their healthcare duties. I also want to note that the governor has signed into law some legislation that establishes an unlawful interference with protected rights for individuals who exercised or attempted to exercise or facilitated or attempted to facilitate the exercise of a right protected under New York State law to obtain or provide lawfully provided medical care. So we recommend making sure that we're aligning around that.
Great, that's very, very encouraging. Glad to have the admin support. Does the admin have any updated data regarding people coming from out of state to New York City to receive abortions?
We do collect data on abortion in our city. I'm going to turn to my colleague, Dr. Stein, to talk a little bit more about that.
Thank you. We are, at the agency, we do continue to believe that data is one of the most important things we can do to advocate for health equity and to ensure we have the best information available to all of you to be able to advocate for change. The most recent data we have available is the 2019 data. We are currently looking at the 2020 data.
And is this data broken by race, age, where the influx of patients are coming from? How is this data broken up?
Thank you for that follow-up question. Yes, the data that we report on induced terminations of pregnancy are broken down by residents of the person who's receiving the abortion, either in state, in the city, or out of state. And it's also broken down by race, ethnicity.
Great. And is there an evaluation process to broaden the sort of disaggregated data so that we are fully equipped as a city to be our best in this moment?
The data we have available is designed to try to provide as much information as possible to ensure that we have the best tools to support our residents. We're also very mindful of the sensitive nature of the data and how carefully we want to protect the privacy of both the patients who are seeking abortion care and the providers who are offering it. And so we do have, the data that we have on the website has been considered for those criteria.
And how else is the data used? What does it inform? Would love to know a little bit more.
Thank you. We do believe, Councilmember, that the data is used by a number of resources around the city to help plan and inform program development for reproductive health services, we ourselves look at the data to try to help inform our own programmatic efforts and make sure that we can advocate for resources being put into the areas that are the most at need, and look at the root causes for how we get to our outcomes to make sure that we're supporting people's best health outcomes.
That's really great to know. And then is it possible to get the data on what the top needs are of people who are coming in from out of state?
That's something I don't have, but I can certainly circle back after testimony.
Yeah, I ask this because in addition to this piece of legislation, I've been advocating for increasing the city's abortion access fund to $500,000 and then adding $500,000 for practical support. So it would be great to know what the administration is doing to provide practical support, such as travel, lodging, and childcare, and if those are the top issues that might be prohibitive for people who are coming in from out of state, and other issues that the municipality could cover.
Thank you, Councilmember. It's a great question. The department does not currently directly provide any abortion services or the kind of wraparound support that you are describing, but we are keenly aware that those wraparound service needs are often what determines whether somebody is able to access abortion or not. And just as you're describing transportation, lodging, childcare, lost wage compensation, those really are pivotal basic needs for people who need to access care. We are talking actively with our partners to better understand that landscape of need and plan for what might be possible in order to meet it.
Great, thank you. I'm looking forward to continued discussion about the pieces of legislation. Thank you.
Thank you, and I'm going to pass it over to Councilmember Brewer.
I want to know who's going to get the extra bedroom in Gloria Steiner's apartment. That's what I want to know. She said she has it available. So I guess I want to understand, first, there's the folks who are coming from out of town whom we want to be supportive of, and then there's folks from New York. So I believe the Attorney General has a fund. I believe there's a state fund, and there's a city fund, and I assume there's private funds also. How does one, does Planned Parenthood apply? Does the woman apply? How does this all get coordinated?
Councilmember, that's a great question. And we know that our system of healthcare is fragmented, as you are describing. I can speak first to what we know about the legislation, the state level legislation. So Governor Hochul in early May directed the Department of Health to create a $25 million fund to expand both provider capacity and access for patients seeking care. The first 10 million in awards were released last month. Okay. And we know that 4 H&H sites in our city and Planned Parenthood of Greater New York received those awards. And so right now, the kind of navigation that you're describing, ensuring where to obtain care, how to pay for that care, that often is facilitated by the individual provider or the provider agency.
Okay, and is that the same as the AG fund, or is that a different fund, or you don't know? I understood that the AG had a fund. Maybe I'm wrong.
I do not have that answer right now, but we can certainly get back to you after this hearing.
Okay, well, we can find out also. My understanding is that she does have a fund, and then you have a fund. So what happens with the small New York City fund? How does that get allocated?
I think you might be referring to the New York Abortion Access Fund, which is a small volunteer-run fund here in our state. The health department does not directly fund NIAF. City Council funds.
No, I know. I
NIAF.
just want to know how does one access those funds? Though you don't know.
Oh no, that's a great question. We do know the answer to that. They call. There is a hotline number, and they can work directly with someone at NIAF to access that money.
And is that tied into 311? If somebody calls 311 and needed, would 311 know to go there?
311 does have information both about how to direct people to an abortion provider and to the funds that we're talking about.
Okay. So, and then also, I know this sounds, I can't believe again I'm saying this, but at the airports, is there some information there so that people don't end up at the fake clinics or et cetera, et cetera? Are you thinking about airports or train stations, et cetera?
That is a great suggestion, and we will take that back to the department.
Okay, Port Authority should help. Okay. Also, okay, now, I mean, it's beyond, hopefully you're coordinating, I think you are, with folks around the country. It's very challenging. In terms of New York, the abortion pill issue, what's your position on the bills that exist here on that topic? Those bills were not on your list of support.
Councilmember, I think you're referring to Introduction 507? Yeah, so we support the intent of this bill, and we are really looking forward to working with council to align our goals to provide safe and equitable access to birthing people. We know the health department believes that access to the medications, mifepristone and misoprostol, should be expanded for all people who need them, and we fully support making these medications available free of charge at the department's sexual health clinics. Those are the centers that would make the most sense financially and clinically. We're looking forward to discussing further with council after the hearing.
Okay, and then my other question would be what are you doing about outreach? Because people are going to get misinformation. Schools, CUNY, and pharmacies. How are you working? Unfortunately, it's a different world. And so we have very bad health information in the schools. CUNY may be a little bit better. And the pharmacies is everybody's doctor.
Councilmember, those are great questions. I can say that we are actively working with our partners to ensure that we are disseminating accurate information in those venues that you're describing. And I want to take a moment to talk about a program in our bureau, the New York City Teens Connection, which is a program, an adolescent sexual health program that partners very closely with DOE to ensure that adolescents are receiving high quality, accurate sexual health education in places where youth already are, so schools and youth serving organizations.
Okay, I mean, I don't mean to be rude, but there's very little school-based health care for a whole series of reasons in the schools. So where does this program exist that you just mentioned?
So New York City Teens Connection exists within our bureau. We partner with the Department of Education.
That's always a problem right there, just FYI.
We partner with the DOE to make sure that there is evidence-based health education curriculum, and we also partner with a very wide network of health clinics throughout the city that we have assessed as teen-friendly and make links between youth in schools or in youth-serving organizations and those clinics to make sure they're getting appropriate care.
Okay. I mean, I don't need to contradict you, of course, but I'm just saying during the summer, you've got Summer Rising, and then you've got SYEP. That might be a better system than trying to work with DOE, which I think is a non-starter, personally. So I'm just suggesting, I'm worried about people getting bad information because it's time to do that. How do you work with the pharmacies? And then I'll stop.
Pharmacies are identified as one of our critical stakeholders. We are working on a plan to engage them as partners, and we would welcome any input you might have about how best to do that.
All right, I mean, the pharmacies are where people go, particularly post or currently with COVID. They go there for information more than any other place. That's what I'm finding. All right, thank you very much.
Thank you. And I actually have some direct follow-up to Councilmember Brewer's questions. First, I certainly appreciate you naming explicitly some barriers to access for folks traveling from out of state, including childcare, lost wages, lodging costs, et cetera. Has the administration thought specifically about programs and funding to help address those barriers? Because as Councilmember Brewer noted, there's state funding to support providers, and the city has the wonderful Abortion Access Fund, but many of us have been advocating for increasing resources to put money directly in folks' hands to seek care. And so would the administration support this?
Thank you for your question, Chair. We agree that that is a critical need. We'll need to get back to you on an answer about the administration's support.
Yeah, I think, and this is something that sort of comes up a lot. I think it's really important that the administration and our council comes out and says, we're going to be the safe haven. We're going to make sure that this can happen for you. But if they are unfunded mandates without the ability to meet the people and actually do the thing, then it's nothing more than rhetoric. And so I just would like to see just real hustle on saying hey, this is a priority and we're going to put our money where our mouth is. And then the other thing, it might be a question for you, council member, is that I'm just trying to get a little bit of clarity because I think I might be misunderstanding some in terms of the AG fund you mentioned. I wasn't aware of the AG having a fund. My understanding was that the Attorney General had come out in support of the fund that would be created by the legislation that's carried by Assemblymember Gonzalez Rojas, which is what okay.
But hasn't passed it.
Yeah, got it. Okay. Great, thank you. I just wanted to make sure I was understanding that. Okay, so I want to sort of shift gears a little bit. We've heard in previous hearings with the Commission on Gender Equity about the important work the city did in convening the New York City Health Education Task Force. And that was something that was just touched on by the council member as well. And while the task force no longer exists, is that something that the city is focused on, or would the city consider reconvening such a task force in light of the Dobbs decision? Like in 2018, one of the recommendations of the final report of the Sexual Health Education Task Force was to assess the content of sexual health education curricula in New York City. And specifically, page 15 of that report recommended that students be more engaged in education equity efforts and engage in the process. And so are there updates on that process as well?
Thank you. I'm happy to answer that question. So as you mentioned, the task force was convened by the Commission on Gender Equity, our sister agency, and we were active participants in that. I can't speak to CGE's plans for reconvening the task force. I would need to defer to them. But I can say that one of the things that we have been actively working on through New York City Teens Connection is engaging our youth as leaders in all aspects of the sexual health programming that we offer through that. And so we convene multiple local community action teams and youth leadership teams to inform the work, to guide the work, to help scope and shape even the materials that we offer through New York City Teens Connection.
Thank you. And moving to contraception, in what ways is the city working to make contraception more affordable and accessible?
Thank you for that question. That's a priority. We share that commitment and value with you, Chair. I'm going to hand this to my colleague, Dr. Stein, to talk a little bit more about it from her position as a provider.
Thank you so much for that question. We are really pleased to work so collaboratively and closely with our colleagues in Department of Health and Mental Hygiene. We have a sexual and reproductive health clinic. Those clinics are available to folks in New York City who need to access STI, HIV testing and treatment, HIV pre-exposure prophylaxis and post-exposure prophylaxis, immediate initiation of antiretroviral treatments, cancer screenings, reproductive health services such as contraception, like you're mentioning, emergency contraception, and long-acting reversible contraception.
Yeah, and a follow-up question to that is that like, you know, are those things mainly, you know, are they being funneled through the Gotham clinics? Is that the main source of?
Chairperson, I believe the Gotham clinics you're referring to are connected to our sister agency at Health and Hospitals. They also run a number of services. I would defer to them to speak to the extent of the services they provide there. The services I was talking about were the services at the sexual and reproductive health clinics through the New York City Department of Health.
Okay. Yeah, and the reason why I ask about the Gotham clinics is because, you know, when we talk about accessibility to any of these things, you know, the presence of, you know, a New York City Health and Hospitals site is really important, and there are obviously still some districts, mine being one of them, that actually within the bounds of my district does not have a Gotham clinic. There is no H&H site in our district, and so there are still some gaps. I mean, those are overall, you know, access to healthcare gaps, but obviously will have an impact on whether or not we're reaching folks for reproductive health care. Can you describe how DOHMH partners with CGE, DOE, and I note the concerns that Councilmember Brewer has with DOE holding some of these things, and other agencies to educate New Yorkers more, you know, more specifically?
Thank you. Our partnership with CGE and DOE is longstanding, and we collaborate around the program I was describing earlier, New York City Teens Connection, which is an adolescent sexual health program within our Bureau, Maternal, Infant, and Reproductive Health. It's an expansion of Bronx Teens Connection, and we are scaling up with the support of our partners throughout the 5 boroughs where we see the greatest need.
What does scaling up mean? Like, can you give me like numbers, a scope, something that would help me visualize like what that actually means?
Yeah, that's a great question. I don't have exact numbers in terms of participants served at hand. I can get that to you after the hearing. What I can say is that we are very closely using data to look at adolescent pregnancy rates and locate our programs where we see the greatest need.
Okay, and then I guess my follow-up with that would be to make the very direct request for data around how many people in New York City are visiting DOH-MH health centers and other facilities every year, how many visits for sexual health counseling and services, how many are seeking information or services pertaining to contraception, and then the last question maybe you can answer is are services at the clinics free for people who can't afford it?
Yes, I'm going to answer the first part, and then I'm going to pass to Dr. Stein. Yes, we would be happy to share information with you and appreciate your interest in looking at the data with us. And I'm going to hand it to Dr. Stein.
Thank you so much for your interest in that specific data. I don't have those numbers in front of me right now, but we can circle back with you afterwards to try to answer some of those questions.
Great, would really appreciate that, thank you. And then I'm gonna go ahead and pass it over to Councilmember Gutierrez for another line of questioning.
Yes, Chair Cohen. My first question is, what is the process for a pregnant person seeking medical attention in potentially a high-need situation or a late-stage patient seeking an abortion? What is that treatment as far as like prioritizing them, and does that differ between a New York resident and an out-of-state resident? Like, what does that dynamic look like?
That is a great question, Councilperson. I'm going to ask Dr. Stein to respond.
Thank you so much. It is so important to all of us that we make sure that people who need services have access to them in a timely fashion. The process that we're trying to provide from the Department of Health and Mental Hygiene is accurate information and making sure people know where to access services. We are trying to keep our website up to date with the sites that people can get safe and affordable abortion and reproductive health services. And when patients reach out to those places, it would depend on where they go as to what the process might look like.
Thank you. So there's no clarity you can share on whether or not a patient coming from out of state that is categorized as high risk, is that a different level of treatment or priority versus like folks who are there on the roster in state? I just want to get and I think, you're a medical professionals. I just want to make sure it's on record. I trust the priority order. I just want to get that clear.
Thank you for that follow-up question. We've been working really closely with our partners who do provide direct service to patients to make sure everyone comes together and are sharing their best practices. We recognize that there's going to probably be a big influx of people coming from out of state, and everyone is committed to making sure that people who need services have access to services and are aligned in the ability to triage and identify people who need services faster.
Okay, thank you. And my last question is a little just back to language access. So this is an experience that I personally am having with medical providers and language competency, and what is deemed as, yes, I do speak this language, and whether or not that's like culturally relevant, whether or not you're translating in the way that makes sense to me. And so the reason I brought up language line is because naturally I'm concerned about what that quality assurance looks like. So what have you all thought about as far as language access, quality control in these instances, right? I can only speak to Spanish. That's the only other language I speak. We have different words. Different countries, different nationalities have different words for different meanings. So what does that quality control look like for the Department of Health in these instances when folks are seeking assistance in another language?
Yeah, that's a really important question, because I think you're speaking to the differences between literal translation and interpretation. And we know that people are most likely to truly understand and be able to communicate clearly with someone who, is a native speaker or who really has some cultural congruency with the patient. We cannot speak personally to the quality assurance on the language line because that is not in our bureau, but we're happy to circle back with you after the hearing.
Yeah, I'm also interested, and that's something that I'm also digging into just through my committee, but I'm interested on what the agency's position is on quality control just within your provider network of, different providers that say they speak the following languages. Like, what is that quality control and ensuring that, like, is there feedback on opportunity, but what does that process look like?
Yeah, that's a great question. We'll take note of it and happy to circle back with you.
Thank you. That's all, Chair. Gracias.
Thank you. I just have a few more questions before moving into questions directly related about the pieces of legislation. I want to talk more about the intersection of COVID, the COVID-19 pandemic and reproductive health. How has the pandemic impacted access to sexual and reproductive health resources in New York City, and how is the city, specifically addressing those issues? You touched on the acknowledgement that there has been an impact, and again, specifically in low-income communities among, young folks, and again, going back to where we find the biggest gaps and disparities for cisgender and transgender folks. And for folks who are, non-binary or gender non-conforming.
Thank you. I want to acknowledge that the pandemic had an unprecedented impact on people's utilization of healthcare and access to healthcare, and many people deferred or put off or did not engage in what we know to be critical routine preventive health services as you're describing. And so, really want to use this opportunity to encourage New Yorkers with your support council to now is the time to get that preventive care. I also want to turn to Dr. Stein to see if you have anything to add from your perspective as a physician in this space.
Yeah, and I would add to that, to your point, saying that like now is the time to get that preventative care. How is the city meaningfully working to bridge that gap and help not only incentivize but facilitate people getting that preventive care?
Mm-hmm.
Thank you so much. We are always trying to make sure patients have access to information on where to get services, where to enroll in insurance, where to get aid when they need it. And so we have done and will continue to do that to message for our patients to seek all care, primary care, preventive care, in addition to the specific reproductive health care that they may have delayed during the pandemic.
Councilmember, I also want to note that the department is working with NYC Care, and we have worked on some PSAs around this topic, and we're really open to council's suggestions in this area as well.
Okay. Wait, I'm sorry, I didn't hear that. I didn't catch that last part you said.
We were open to any suggestions council might have about how to really promote and bridge those gaps.
Great, yeah. Would love to be in conversation about those things. Okay, so when the federal government implemented the gag rule that would have undermined the integrity of family planning programs in August of 2019, then Governor Cuomo and the New York State Department of Health decided to decline the $25 million per year in Title X grants that the state had been receiving. And so while New York State included $14.2 million in funding for such services in the fiscal 2021 state budget to help ensure that New Yorkers receive continued, to have access to sexual and reproductive health services, funding gaps obviously remain, right? And so in what ways have these funding gaps affected organizations and healthcare providers in New York City? And has DOHMH been asked to help support the effort to fill those gaps, or made efforts to do so either financially or in other ways? And then the last piece of that question is just, do you also then believe that the Dobbs decision will further affect those particular clinics?
That is a great question, because Title X is really a cornerstone of family planning and reproductive health. We have been able to maintain access to sexual and reproductive health services in our city. Dr. Stein previously spoke about the sexual health clinics, which serve all regardless of ability to pay. And we also work really closely with our New York State colleagues at the Department of Health in an ongoing conversation about topics like this.
Thank you. Do you have any follow-ups before I move into some of the ledge pieces? And in the outreach that y'all have testified that is being done, is part of that outreach include direct information about people being able to access even if they have an inability to pay? Like, is that a core pillar of the communications plan that's being implemented?
Absolutely, yes. Our sexual health clinics serve everyone, regardless of ability to pay, and we strive to communicate that as clearly as possible in all languages.
Right. Thank you. So moving into Intro 458, the local law requiring the Department of, requiring DOHMH to maintain that language access service for abortion providers. On June 24th, in response to the court's ruling, New York State Governor Kathy Hochul announced that the state would be engaging in an advertising campaign and launching this revamped website to inform folks both in New York and around the country about their rights to an abortion in New York, as well as highlight potential resources available to them. Have y'all been working with the state on developing that website or collaborating on efforts to support access to healthcare across the state?
Yeah, I'm really pleased to say that we have been in close communication to ensure that their website and our website align, and that the overall top-line message, if you've looked at either ours or their web pages, is that abortion is safe and legal in New York City for all. And that is our overarching unified message.
And then, do you think that DOHMH is the best agency to implement this bill if it were to pass?
Thank you, Councilperson. We'd be happy to discuss that further after the hearing.
Okay. Okay, so moving into Intro 465, I know that some questions were asked about data collection. I don't believe this was covered, though. Can you provide more information on how abortion would be defined with regard to such reports, or like really who abortion refers to in general? Like, does this apply to individuals who experience an ectopic pregnancy, for example? What about those individuals who are forced to give birth before the 20-week mark of a pregnancy because of complications? Would the birth be considered an abortion? Things like that.
Yeah, those are great questions because those nuances in the data are really critical. I'm going to ask Dr. Stein to speak to that as a medical provider.
Thank you so much for that question, Chairperson. We at the Department of Health do review all the data for live births and preterm births and induced and spontaneous abortions. And we are providing all of that information on a yearly basis on our website. And so we're able to offer that as a resource to people who are looking into the specifics of those types of data.
Thank you. And then just for clarity, correct me if I'm wrong, I think I heard this in your opening testimony, that for intros 466 and 475, that the administration is generally supportive of the intention of the legislation and wants to continue discussions as we move on them. Is that correct?
I'm sorry, Chair, would you just repeat the numbers one more time?
Sure, 466 and 475.
That is correct.
Thank you. Do my colleagues have anything else? Okay, I think we're all set. Yeah. All right.
Okay, so that concludes the administration portion of this hearing. Thank you so much for your time. We'll now move to the public testimony portion of the hearing. We'll just take a 1-minute break before beginning. The first panel will be a remote panel with an assembly member. We'll then go to a second remote panel, and then we'll do an in-person panel. So again, 1 moment, and then we'll move to public testimony. Thank you. Also, apologies, just a housekeeping matter. My name is Brenda McKinney, and I'm counsel of the Committee on Women and Gender Equity at the New York City Council. Also, a reminder that we will accept written testimony up to 72 hours after the hearing. There's no limit to written testimony, and it can be sent to testimony@council.nyc.gov. Thank you.
All right. Oh, okay.
Okay, we'll now resume testimony. So we will go to the first public panel, which will be Assemblymember Gonzalez Rojas. Assemblymember Gonzalez Rojas, you may begin your testimony when the sergeant calls the clock.
Time starts now.
Great, thank you. Good afternoon, Chair Caban and members of the Council's Committee on Women and Gender Equity. I'm Assemblymember Jessica Gonzalez Rojas. My pronouns are she, her, ella, and I proudly represent the 34th Assembly District in Queens. I testify today not only as an Assembly member and the prime sponsor of the bill, but as a longtime reproductive justice advocate. I spent the last 13 years running the National Latina Institute for Reproductive Justice. So right now, in this country, corporations and guns have more rights than women and people with the capacity to get pregnant. The Supreme Court's decision to overturn Roe requires bold and urgent action. And that's why I introduced the Reproductive Freedom and Equity Fund in the Assembly, and why I encourage you to pass Resolution 195 and all the important bills that you're talking about in this hearing today. The Reproductive Freedom and Equity Fund Act would codify into law a reoccurring fund managed by the New York State Department of Health that would accomplish three things. One, provide ongoing funding to address capacity needs for abortion providers and clinics to cover costs such as expansion of staff, infrastructure, and security. Two, cover the gaps for patients who are uninsured, underinsured, or whose insurance is not accepted. And three, provide funding towards organizations that facilitate access to abortion to address the practical needs of those seeking care. So examples of that include transportation, lodging, translation services, doula care, and childcare, because most people who seek abortions are already parents. According to multiple statistics and sources, in 2019, 7,000 of the annual abortion procedures performed here in New York were from people from out of state. With Roe overturned, it is estimated that that number could jump to over 32,000 procedures a year just from people traveling from Ohio and Pennsylvania alone.
Time expired.
New York will be the nearest provider of safe, legal abortion care for up to 280,000 more people of reproductive age. I will wrap up in a second. We will do more, we must do more to ensure our healthcare system can meet this need. My bill has the support of our Attorney General, the Senate Majority Leader, reproductive justice organization, and labor unions. I am proud that we have stepped up to be a safe haven for abortion care, but a right to an abortion without access to that right is not a right at all. So without this fund, our state can perpetuate the same barriers that have disproportionately impacted Black, Latinx, AAPI, Indigenous people, transgender folks, immigrants, people in poverty, and people with disabilities for decades. Passing the Reproductive Freedom and Equity Fund isn't radical, it is responsible. Thank you all so much for your support.
Thank you. And I just want to extend my gratitude to you, Assembly Member, because you have been a leader and an expert on repro justice issues far before you entered our state legislature. So we're very lucky to have your leadership in state government. So thank you.
Thank you, Council Member.
Okay, thank you so much. We'll now move to public panel 2. We will name everyone on the panel. If you are not present, or we might have 2 people signed in as the same, we're working on technical difficulties behind the scenes. But we'll name every panelist on this next panel, and it will be Dr. Colleen Achong, and apologies for any mispronunciation, Dr. Colleen Achong, Dr. Anna Russler, Dr. Samantha Hayes, Dr. Sarah Feitel, Dr. Stephen Miller, Dr. Lily Ostrower, and Dr. Jing Ye.
And if I may add, I'm just going to make a request of the staff here. Can we please turn off the timer clock for Dr. Colleen's testimony? Can we make sure that that doesn't go off? And I want to start off, I'll do it again after the panel, but start off by really thanking all of the doctors for being here, because your testimony is incredibly, incredibly important.
And just from a logistical standpoint, if you are logged in under a different name or having issues, if you can use the raise and are planning to provide testimony or on this panel, if you can please use the raise hand function in Zoom to let us know who you are and that you're ready. We do not see the first panelist, but I will call names just in case. And again, please use the raise hand function in Zoom. Dr. Colleen A. Chong.
I'm here.
Okay, and you may begin your testimony when ready. We will not be using a clock.
Okay, good day. My name is Dr. Colleen Chung. I'm an internal medicine resident at One Brooklyn Health and a regional vice president for my union, the Committee of Interns and Residents. Thank you for this opportunity to testify in support of the Resolution 195, calling on the New York State Legislature to pass and for the governor to sign the Reproductive Freedom and Equity Program. I was born in Trinidad and raised here in Brooklyn. I'm proud to serve the community, and I am proud that in the face of abortion rights being rolled back across the country, New York is taking action to ensure the right to body autonomy and abortion care for all. Today, I want to talk to you as a doctor who has assisted in abortions, counsel patients considering abortion, and seen patients in crisis after trying to unsafely terminate a pregnancy. I'm sorry for the noise in the background because I'm currently still at work. I also like to talk to you as a woman who has had an abortion myself. Like far too many women, this is emotional for me, but I'd like to share that I was raped. I was in shock, processing what had happened, and did not take the plan B. Weeks later, I was very sick and didn't understand what was wrong with my body because I was young, immature, and was not a doctor yet. I found out that I was pregnant. I sought out care through Planned Parenthood and received counseling and a safe termination. It was not just the safe termination that was important, but also the counseling that these amazing healthcare providers gave to me. I grew up in a very strict Christian home. When I discovered that I was pregnant, I was scared and confused. The counseling that I received was so important and life affirming for me. They talked to me about how my life shouldn't be determined by what my mother or my family thinks, and that it's up to me, and that I had the choices available at the time to make that decision. I don't know how I would have been okay without the counseling. Because of their care and expertise, I was confident by my decision and didn't feel ashamed, judged, or rejected, despite my strong religious background and beliefs. I do not have to imagine what situation would have been if I didn't receive the safe termination and the expert counseling and care that I receive. We have all heard horror stories, but as the medical student in Maryland, I saw it firsthand when young girls came into the hospital in shock and hemorrhaging because they didn't have the same access to care I had and felt like they had to resort to unsafe measures to end their pregnancies. My life could have been so different. And if I didn't have the care that I received, it should be every person's choice whether to continue a pregnancy or not. For me, I didn't want to carry that life and relive the trauma of the rape. If New York is to truly be a sanctuary state for pregnant people seeking abortion care, we must ensure our abortion providers have all the funds and resources they need to provide every woman the level of care I received. The lives of women like me depend on it. As a doctor serving a diverse community in Brooklyn, I see every day how our immigrant patients face language barriers when trying to receive healthcare. I cannot imagine how much more traumatic my situation would have been if I couldn't communicate in my native language with my abortion providers. I testified a few months ago at another council hearing on the improvements needed to ensure real language access at our hospitals. The city must take action to ensure language access for patients seeking abortion. Healthcare is not truly accessible without language access. For this reason, I ask you to support the Intro 458 requiring DOH to maintain language access for abortion providers. The state legislature must immediately pass and governor must sign the Reproductive Freedom and Equity Act. Thank you for the opportunity to testify today, for taking real action to protect my patients and all pregnant people seeking abortion care.
Thank you so much for your testimony.
Thank you so much. And then we will read all the names on the panel. And then if council members have questions, we'll save them to the end of the panel. So the next witness on this panel is Dr. Anna Russler. If you are signed in under a different name, for anyone on this panel, please use the raise hand function in Zoom so we know who to unmute. And you may begin your testimony when the sergeant calls the clock. Thank you.
Time starts now.
Good afternoon. I'm Anna Russler. I'm a pediatric resident physician at Jacobi Medical Center in the Bronx and a member of my union, the Committee of Interns and Residents. Thank you for the opportunity to testify today in support of Resolution 0195, calling on New York State Legislator to pass and the governor to sign the Reproductive Freedom and Equity Program. As a pediatrician, I counsel patients on their decisions to seek reproductive care and see patients struggling with the stigma of choosing to undergo an abortion far too often. With the Supreme Court's decision to overturn Roe v. Wade and the many abortion bans being passed across the country, the stigma will only worsen. Abortion is healthcare, and there should be no stigma. Pregnant people should not feel the shame for seeking the care that they need and making the decision that is right for them. That is one of the many reasons that we must ensure all people can access abortion care in our state and that abortion providers in New York have the resources they need to care for them. We need the Reproductive Freedom and Equity Program to achieve that. I'm asking for your support of Resolution 0195, not just for my current and future patients here in the Bronx, but also for my family, my friends, and the patients in my home state of Indiana. Indiana already has highly restrictive abortion laws, and as a medical student there, I advocated with all I had to change this. But now with the overturning of Roe, abortion is likely to be banned in Indiana in a few weeks. Indiana already has one of the worst maternal mortality rates, and I truly fear for the health and well-being of the pregnant people in my home state. We need to ensure that New York is truly a sanctuary state for women like those in my home state of Indiana who cannot receive the care they need where they are. And for our abortion providers must have the critical resources they need, like the appropriate translation and interpretation services. This is crucial in making patients comfortable and combating the increasing stigmatization of abortion care. At Jacobi, I treat a diverse population and we rely on the telephone translation services. I regularly have to wait long periods of time to get the interpreters for the many languages and often simply can't get a hold of the language for services that I need. This is a barrier to care in all realms of healthcare, but especially so in abortion care. And when a patient has had to take time off to work or travel, they do not have time to wait, nor do they need the additional stressors of being unable to communicate. I urge you all to support wider investment in translation and interpretation services across all healthcare fields and ask you today to support Intro 0458 requiring the DOH-MH to maintain language access for abortion providers. The state legislator must immediately pass and the governor must sign the Reproductive Freedom and Equity Act. Thank you all for the opportunity to offer this testimony today. I urge our leaders to act and support reproductive rights and healthcare access. Thank you.
Thank you.
Thank you so much. The next witness will be Dr. Samantha Hayes. You may begin your testimony when the sergeant calls the clock.
Okay. Oh, sorry, has the clock been called?
We can hear you, Dr. Hayes.
Okay, thank you. Good afternoon. I am Dr. Samantha Hayes. I'm a psychiatry resident physician at Maimonides Medical Center in Brooklyn and a member of my union, the Committee of Interns and Residents. Since last Friday, I have felt so much rage, and I still feel that for myself, my patients, my family, my friends, and all people with uteruses. I'm truly grateful for the opportunity to testify today and channel that rage to call on you to support Resolution 195, calling on the New York State Legislature to pass and the governor to sign the Reproductive Freedom and Equity Program. This legislation is critical to ensuring abortion providers in New York have the resources they need to provide abortion care to all seeking it, so New York can truly be a sanctuary state in action, not just in rhetoric. I'm a very proud New Yorker. I was born in Queens, and I am proud to be a psychiatrist in Brooklyn. And since Friday, I've been thinking a lot about why I chose to be a psychiatrist, and really fell on one case that made me choose psychiatry. This woman in her 50s who opened up about her life story. Everything was very clear until she got to the point where she had an abortion. And as soon as that abortion came, so did the changes in her dialogue. She began saying the television was talking to her, people were following her, and coworkers wanted to hurt her. It became clear that from this dialogue that the stigma and guilt of having an abortion had so traumatized this patient, it had triggered her first psychotic break of her long-standing impairing diagnosis of schizophrenia. I don't know what other underlying issues she had, but it was clear as she spoke that the stigma and shame from her abortion was the tipping point into mental illness. Seeing that patient, I decided I wanted to be a psychiatrist. I wanted to help people and provide care to patients like her. And as we take action as a city and a state to ensure access to abortion care for all seeking it, we must not forget the mental health needs of patients and providers. We must take an intersectional approach that meets the unique needs of those living with mental health disorders. We also know that those living with chronic diseases, whether psychiatric, rheumatologic, cardiologic, or others, are more likely to be living in poverty and unable to afford necessary medication. To ensure true access for our most vulnerable, including many of my patients, I urge you to support Intro 507, requiring the Department of Health and Mental Hygiene to make mifepristone and misoprostol available free of charge at its health centers, health stations, health clinics, and other health facilities. I also see patients who struggle to process their psychiatric diagnosis and the need for medication. As psychiatrists, we spend a lot of time doing paperwork and dealing with insurance companies to remove the barriers our patients face in taking their medication. Removing the barrier of cost will not only help patients, but abortion providers, as well as those who will not have to fight with insurance companies or spend time doing this additional paperwork. And with the many burdens that healthcare workers must carry, we must take action to properly support and protect them. Since the Supreme Court decision was leaked, our union has heard from our members and residents across the country who provide abortion care. They are justifiably confused and scared that they will be prosecuted or sued for caring for their patients. This is incredibly detrimental to the mental health of our members who are already dealing with the stressors of long hours, low wages, high student debts, and the traumas of being a healthcare worker in a global pandemic. We dedicate our lives and sacrifice so much to become doctors for our communities. We cannot properly do our jobs in such conditions. This is why the city must protect abortion providers. So I also urge you all to support Intro 466, prohibiting the use of city resources to enforce abortion restrictions and create a private right of action related to detention. Thank you again, Chair Caban and council members, for the opportunity to testify today. For the sake of us, our patients, and communities everywhere, I urge you to support Resolution 195, Intro 466, and Intro 507.
Thank you.
The next witness will be Dr. Sarah Feitel. Again, apologies for any mispronunciations. Dr. Feitel, you may begin your testimony when the sergeant calls the clock.
Time starts now.
Just one moment. We're just checking if Dr. Sarah Feitel. Okay, we're going to move to the next witness. And if Dr. Feitel comes back on, we're happy to check at the end or come back to her on this panel. The next witness will be Dr. Stephen Miller. Dr. Miller, you may begin your testimony when the sergeant calls the clock.
Time starts now.
Greetings to the committee, and thank you for allowing me to speak today on behalf of myself and members of CIR. My name is Stephen Miller. I'm a physician at the Brooklyn Hospital Center. I'm a pulmonary and critical care fellow and also the regional vice president for CIR, the Committee on Interns and Residents. I'm speaking today in support of the resolutions that have been brought forth, especially 0195, the Reproductive Freedom and Equity Program, among the others. I think these are important resolutions, and it's important for us to pass these laws, especially in the face of the current political climate, the overturning of Roe v. Wade, and the assertion that bodily autonomy does not belong to all the members of our state nation. The healthcare inequities that we witness on a daily basis in the city of New York are already alarming, and having further erosion of people's personal choices with regard to their health and their interactions with their physicians is extremely alarming. You know, I'm not only a physician, but also a father and a husband, and I feel that it's a responsibility as a physician, as a community member, to my wife and to my daughter, to make sure that these freedoms are not further eroded. We need to establish this money in this resolution to make sure that there's access to healthcare for all women. And as a state and as the city of New York, the greatest city in the world, we should be leaders, and we should set an example for the whole world for how things could be done and should be done. And if people are going to be coming here from outside the state, then we need to make access to healthcare for them available, equitable, and affordable. And that's why we need to make abortion pills like mifepristone and misoprostol free and easily accessible to all women who need them. We should go further. I don't think that these bills actually go far enough, and healthcare should be free in general.
Time expired.
But especially reproductive healthcare should be somehow made accessible and free, because these issues are going to affect the poorest women the hardest, and these are the people who are going to suffer the most. So I hope that you will support these laws being written into our state legislation in the coming weeks and months. Thank you.
Thank you.
Thank you for your testimony. We'll now move to the next witness, which is Dr. Lily Ostrower.
Time starts now.
Hi, thank you so much for inviting our testimony today. My name is Lily Ostrower. I'm an internal medicine and pediatric physician. I just graduated from my residency at Jackson Memorial Hospital in Miami, Florida yesterday. I'm a proud New Yorker. I was born and raised in New York City, went to medical school here, and then moved down to Florida for my residency. And I'm here today calling on New York City and state to take real action to provide care to my patients who can't receive the care they need in Florida anymore. As a pediatrician, I've cared for babies with lethal anomalies and have experienced with their parents the extreme pain of a child dying at or shortly after birth. I've also cared for young patients who, due to varying circumstances, have become pregnant far before they feel ready or equipped to care for a child. And unfortunately, in Florida, we are seeing further restrictions on abortion going into place. This last legislative session in Florida, we had a 15-week abortion ban that passed before the Dobbs case decision. And this ban was supposed to go into place today. It was actually held up in the courts yesterday. And as of now, my colleagues are dealing with extreme uncertainty and where to send our patients. Just yesterday, I spoke with one of my obstetrics colleagues who has a patient after 15 weeks of pregnancy who found out that her fetus has anomalies incompatible with life, and there's so much uncertainty over where she can receive the life-saving medical care that she needs. So I'm here calling on you to support resolution 0195, calling on the New York State Legislature to pass and for the governor to sign the Reproductive Freedom and Equity Program. We need to ensure that my patients in Florida will have the resources that they need to seek abortion care outside of Florida, and that abortion providers here have the resources they need for the increased demand. As some of you may know, there's a strong South Florida, New York connection, and I know that New York will be a lifeline for many of my patients if and when Florida further erodes abortion access. I'm also asking you to support Intro 0466 prohibiting the use of city resources to enforce abortion restrictions. Abortion providers need to know they are safe from prosecution while they're doing their jobs and providing health care. This is something that unfortunately has been eroding very quickly in Florida in recent months, and it's honestly terrifying for me and my colleagues to feel intimidated as physicians as we're doing our jobs. And then also supporting Intro 0507, requiring the Department of Health and Mental Hygiene to make mifepristone and misoprostol available free of charge. This is truly life-saving medical care, and patients should not feel a financial strain in seeking out necessary medical care. Again, thank you so much for hearing our testimony today.
Thank you.
Thank you so much. We'll now move to the final witness on this panel. Again, council members will hold questions to the end of the panel. If Dr. Jing Yi is here, apologies for any mispronunciation, you may begin your testimony when the sergeant calls the clock. Dr. Yi?
Your time will begin.
Hi, thank you. Thank you so much. Good afternoon. My name is Dr. Jing Yi. I'm an OBGYN resident in my final year of training at Brooklyn Methodist Hospital. And I am a member and delegate of the union and the communities of interns and residents. Thank you for this opportunity to testify in support of Resolution 195, calling on the New York State Legislature to pass and for the governor to sign the Reproductive Freedom and Equity Program, and Intro 507, requiring the Department of Health and Mental Hygiene to make mifepristone and misoprostol available free of charge, and Intro 466, prohibiting the use of city resources to enforce abortion restrictions. As an OBGYN resident in New York State, I am trained in providing abortion care, which is an essential part of healthcare. The city and the state must take action to make New York a sanctuary for abortion care. And to do that, we must fund and resource our abortion clinics. At my hospital, we can and do perform terminations. However, it does take a lot of coordination, setting up the operating room, which can take significant amount of time. If anyone here has had or had to schedule surgery, you know that it can take a lot of time. So for patients seeking terminations, a lot of times it's more efficient for them to seek care at an abortion clinic, which is why the Reproductive Freedom and Equity Program is so crucial. These providers must have the funds they need to meet the impending influx of patients coming in from out of state to seek care. It's also critical that the Department of Mental Health and Mental Hygiene provide mifepristone and misoprostol for free at their facilities. The pharmacy at my hospital does not stock mifepristone, so knowing that I can refer my patients to these clinics and know that they will not have to worry about insurance coverage or cost, what is essential for them to continue to receive care. I have two personal stories of patients that I have performed abortions for. The first is during my residency.
Time has expired.
You can continue.
Where a patient had been diagnosed with an anomaly incompatible with life at 16 weeks. It was obviously a very distressing situation for the patient, the family, and everyone involved. But ultimately, that was the best thing that we could do for the patient. As a medical student, I was also involved in providing abortion care to a patient who was struggling with long-term mental health issues as well as other social issues. And that patient was not someone who could manage having another child. And I was very grateful for the opportunity to participate in her care as well. In performing abortions for these patients, I was providing necessary health care. I was caring for my patients, and it is terrifying to think that if I was to do this now, I could be legally vulnerable from these out-of-state places. We work so hard to become doctors and to be able to provide care for our patients, and we cannot care for them if the city doesn't protect us in our practice of medicine. So I ask you all to support Intro 0466 to protect us and enable us to practice without the stress of losing our licenses or being prosecuted for providing healthcare. Thank you again for the opportunity to testify here today, and I urge you to support Resolution 0195, Intro 0507, and Intro 0466.
Thank you so much. We have a few questions for the panel, and I'm going to pass it over to Councilmember Gutierrez.
Oh, yes.
Dr. Achong? Achong, yeah.
Thank you so much, Chair, and thank you to all the residents who testified. We obviously want to be able to work together because you are on the front line, so I thoroughly appreciate your advocacy today. My question is for Dr. Achong. You mentioned in your testimony that you have testified previously regarding how to improve language access, and I'm sorry, I didn't hear that original testimony, so would love to hear what are some of those experiences and what are those best practices that we at the council should be fighting for and pushing that the city implement to improve language access in our facilities?
Okay, so what I testified regarding is that at times there are, what we utilize is a language line. Frequently, we don't have as many in-person translators at least in the OB8 system, we don't have in-person translators per se. So we've been using technology like phone calls or an iPad that translates to the patient. And that results sometimes in computers failing because of the Wi-Fi or poor communication between the patients. So we've been trying to work on enhancing that, or if we do have one, we have one that is being shared. So having that more readily available for patients, especially in the Black and Brown community, it's really important, especially Latino Americans, because of the fact that they deserve care and they're the ones that, in regard to the abortion right, if you cannot communicate with your provider, how can you understand what they're telling you and understand because as a provider, you have to emotionally be able to share with them and also communicate back to them that if this is the decision they want to make, that they should feel comfortable and encourage them. Because care is not just the medicine we provide, but the emotional support and the discussion and the steps that we take towards that medical intervention.
Thank you. Thank you so much. That was very, very helpful. I'm happy to elevate it. Thank you so much.
And I also have some additional questions, but I want to start by, again, extending my deep gratitude and echoing the sentiments of my colleague. Y'all are on the front lines, and your experiences and the information you're providing should be directly informing all of the work that we do here. Y'all know best. And I want to particularly thank Dr. Achong for sharing your personal story. I can only imagine how difficult that is. And I wanted to, this is to all of y'all, please feel free to jump in to answer. Each of you, I think, to some degree touched on some of these things, but can you talk in a little bit more detail about your concerns around the ability for folks to get the training that they need, the practical field, medical experience to provide the kind of care that folks need in terms of reproductive health care, and especially, I know somebody talked about their experiences in other states and, taking residencies and internships in other states and going from maybe a state that has a ban into one that doesn't, and things like that.
I can talk about that briefly from the perspective of a physician in Florida. So I'm an internist and pediatrician. I'm not an OBGYN or family physician, which are the specialties that normally receive training in abortion care. I know that at the hospital that I currently work at, which is kind of the equivalent to the H&H system in Miami, our hospital system only provides abortions up until 13 weeks, which means that our family physicians and OBGYN residents cannot receive training past 13 weeks at our current institution and need to seek that training outside of the institution. If and when the 15-week abortion ban goes into place in Florida, they will not be able to receive training past 15 weeks anywhere in the state of Florida. And so I know that training programs in other states are gearing up to receive an influx of visiting residents from states with restrictions. And I know that, it makes me very proud to be a New Yorker, because I know New York can and will be one of the states that physicians will come to receive this necessary medical training, and I know it's going to become only more necessary and urgent as time goes on. But as of now in Florida, it's pretty uncertain when this 15-week ban will go into effect, and when it does, all of our family physician and obstetrics residents will need to travel out of state for their training.
Thank you. And is there, is there a gap that needs to be met or filled in terms of, I mean, folks testified about the toll it is taking on physicians to try to take care of their patients under these circumstances, under these restraints, under the threat of all kinds of different consequences. Like, is there an adequate infrastructure to support doctors, mental and emotional health as y'all are continuing to navigate the current environment?
I'll speak on that a little bit. Unfortunately, even in the best of circumstances, mental health is stigmatized beyond belief. It's an extremely stigmatized world, and even more so for the physicians who are expected to be perfect. There's this vision of the perfect physician, the perfect resident. Everything is perfect. They're able to take care of everything. But in reality, again, this all takes a toll on everybody. There isn't enough done to support us. It's so difficult because everyone has so many needs, but when are they going to find the time to be able to take it with the 80-hour work weeks and everything being restricted? So access to it is difficult, let alone access to these people who are now in about half of the states in the United States unable to practice the safest care for their patients. So we definitely could use a boost in mental health being provided to residents and physicians.
And I'd love to stay in conversation about what the city council can do to help support that kind of infrastructure.
Well, it has to be said that people have to feel safe. If they're going to come here and they're going to practice, medicine, or if they're already here and they're practicing medicine, they can't feel like there's a possibility that their future licensing or their careers are on the line. I mean, there's nothing more devastating than dedicating, a decade or two of your life to practice of medicine, only to have it all undone because, somebody in Indiana, let's say, says, well, now that you've provided an abortion for a state resident, we're going to come after you even though you did it in New York. And then that could affect, the prospect of you getting a job later on down the line. I mean, that would be incredibly, and that would be terrifying.
Right.
That's also a cost. If people are traveling, residents traveling, I mean, I don't know if you realize it, but we're pretty poorly paid. We make like minimum wage if you break it down by hour. So I don't know where people are going to come up with the money. How are they going to travel to New York City and live here? People who work here can't live here. It's expensive. So I don't know how they're going to afford that. And then you got to add in the cost of insurance. Everybody who comes here who wants to practice abortions from out of the state, they're going to have to get medical malpractice insurance. Someone's going to have to pay for that. Is ACGME going to put up the funds for that? Is Medicaid, CMS, is CMS going to provide the money for that? Are we going to have national? I mean, CMS is national. So who's going to pay for that? I don't understand where that, I don't know if it's been tested yet. I don't think anybody's really thought through what the actual repercussions are of this Supreme Court decision. It's long-reaching.
Yeah, thank you for uplifting those.
Yeah, just to kind of piggyback on that as well, in terms of, I know that I mentioned my colleagues in Florida traveling out of state. It's not something that can be done easily. It is a huge expense, especially on the salaries that we make, and there are a lot of logistical issues that Dr. Miller brought up about malpractice insurance and lodging and the cost of travel. I know that our union has informed us that, and I think this has been in the news as well, that half of OBGYN residents will now be training in states that have abortion bans in place. And so it's going to severely limit the physician workforce that it's capable of providing abortion care. So really finding ways to expand training for out-of-state residents and support them with the infrastructure that's needed to make traveling for out-of-state training possible is going to become incredibly important.
And I think one of my final questions for y'all is, there was testimony about there being just general uncertainty on where to send their patients, and like difficulties with getting the information that you need in real time to be able to make those calls. How can we support with, well, I'd love to know more about that uncertainty. Like what are the things that are being considered, the questions y'all are having to ask yourselves, and then the follow-up to that is like how can we support it? Is it funding? Is it additional things? I'm hearing, and we're taking note of some of the things that have already been suggested in terms of deeper investment to access to different kinds of training.
Yeah, well, one of the resolutions was about transparency, right? In providers providing these services. Which one was it? Was that 4465? Yeah, to report on the individuals who sought and received medical service related to reproductive health care. I mean, I think the idea behind that is that, we need to have some sort of resource that tells us where these providers are that are providing this reproductive health care, and how many patients they're seeing, so that we can help, distribute those patients amongst the people who need the training, because you might run into an issue where, I don't know how many residents there are in OBGYN right now. It's going to be hundreds, thousands probably. And then you've got to divide them into the number of patients that are available. And then they have a certain number of procedures that they have to log in their 4-year residency before they graduate. So, in order to make that possible, we need to make the information available to them about where they should be looking to go and who they should be contacting regarding getting that training. It's a numbers game. And if they don't know where they are, where those people are that are providing that service, especially like, let's say you're in Florida, for instance, are you going to send a patient from Jackson Health to Alabama, Georgia? Where are you going to send them? You're going to send them to the Carolinas? How far away do they have to go before they're going to find a place where there's going to be somebody who's going to be able to provide the services that they need? Are they going to have to get on an airplane or a bus? How are they going to get what they need done? And in real time, it can be difficult, especially like when you have federal judges blocking resolutions, like in Florida right now. Thankfully, somebody stopped that 15-week ban from going into effect, and they did the same thing in Louisiana. But who knows how long that lasts. You have to have like a push alert from the New York Times on your phone while you're at work seeing patients.
It seems like in Florida, at least in South Florida and in Miami, it seems like, in the near future, there won't be anywhere within 1 day's driving distance, like where you can drive, in 1 day and back, where our patients can receive abortion care. So it may be necessary to get on an airplane. And luckily, New York is probably the most accessible by airplane from Miami, just because there's a strong connection between South Florida and New York. So I think for us, really knowing what services are available for our patients, where those services are available, and some assurance that when our patients arrive, they will be able to receive the services that they need, especially in the language, and that they'll have competent care in the languages that they speak. And so I think really ensuring that that care is well publicized and is very accessible. And I think that, I mean, right now as it stands, I have colleagues who drive patients themselves to receive abortion care when it's not something that our health system can do, because we don't want to be in a situation where we tell our patients to go somewhere and then it turns out that where they go to receive care isn't actually able to provide them the care that they need. And so some of my colleagues go to really long lengths to ensure that their patients are getting the care that they need. And so I think, if New York can really provide that information upfront, where the services are available, and an assurance that any who come to seek those services will be able to receive the care they need, I think that would be extremely important.
Thank you all.
I believe piggybacking off of what my colleague shared, I think it's very important that we need to know as doctors in New York how that it would be helpful to know like what services are available and where to refer patients, especially those coming out of New York to receive care. Where is the best to direct them?
Right. Thank you.
Yeah, and how are they going to pay for it? That's the other thing.
Yeah.
I mean, because a lot of insurance I've found just dealing with social work stuff in the hospital is state-based. So, who's going to be an in-network provider for somebody? Or is CMS going to start picking up these costs? How is that going to work? I don't know. I don't think anybody's talked about that yet, or if they are, I don't know if anybody's publicized it.
Thank you. This is all really, really helpful, and we definitely would like to follow up with all of you as we move forward.
Okay, thank you so much, doctors. This concludes this panel. So we'll now be moving to the next panel. And again, we will be following up and have followed up with offline as well. The next panel will be our in-person panel. So we'll be calling Miss Ellie Miller from New York Midwives. We'll just take a 1-minute break because this will be in person and it will only be one witness. So just one moment and we will move to the next panel. Thank you. And just due to limitations with Zoom and our present situation, there are several council members that the chair noted were present online, council members Riley and Brooks Powers, but who are not able to participate due to quorum requirements. So the chair will be reading a statement from Councilmember Brooks Powers.
So on behalf of Councilmember Brooks Powers, she says, "Good afternoon, everyone. Thank you. I'd like to speak briefly in support of my bill being heard today, Resolution 196, calling on the state to pass legislation that will allow out-of-state physicians to provide reproductive health services in New York while they await full licensure. By officially moving to take the right to a safe abortion away from millions, the Supreme Court has callously criminalized health care for millions of women and torn at the fabric of our democracy. Dobbs will endanger the lives and health of countless people. New York has long been a sanctuary for women seeking abortion and other reproductive care services, even before Roe was the law of the land, and we will continue to be, and that's why we must fight to protect abortion access for people across this country. As demand for reproductive health care services is poised to shift significantly, we will need to act quickly, enable as many medical providers as possible to begin serving people seeking abortion in New York State. We cannot delay. I'm honored to join my colleagues on the suite of bills being heard today and look forward to discussing further. And again, that's a statement provided by Councilmember Sylvina Brooks Powers.
Thank you. And we'll now move to our next panel. So again, this is an in-person panel. The next witness will be Ellie Miller from New York Midwives. There is an in-person clock on the wall, and you may begin when you're ready.
Good afternoon. Thank you for this opportunity to testify today. My name is Ellie Miller. I'm a registered nurse who worked in obstetrics for 9 years in New York City hospitals. I'm a newly licensed certified midwife in the state of New York. I'm providing testimony on behalf of and represent New York Midwives. New York Midwives is the professional organization that represents New York State's certified nurse midwives and certified midwives, and is the state affiliate of the American College of Nurse Midwives. The ability to choose whether or not to be pregnant is a basic human right. The recent reversal of Roe versus Wade by the Supreme Court created a crisis for all Americans, especially those capable of pregnancy. Abortion care is an indispensable component of comprehensive reproductive health care. New York Midwives, a pro-abortion organization, will collaborate with allied organizations and city and state health departments to provide abortion care within midwifery scope of practice. New York City's elected representatives have submitted several introductions and resolutions. I would like to offer the support of New York Midwives to these introductions and resolutions. Providing health care in a patient's preferred language is the bedrock of holistic health care and is critical for effective abortion care. New York Midwives supports Introduction 458. New York Midwives supports Introduction 465, Report on Provision of Medical Services Related to Reproductive Health Care. However, resources currently exist that can be accessed to eliminate redundancy in this area. Accurate, timely data collection and dissemination of information on reproductive health care improves services, access, and outcome. The Bureau of Infant, Maternal, and Reproductive Health collects such data. Extrapolating this existing data eliminates redundancy and allows for more efficient data distribution. Information regarding types of abortion care, how to find a provider, support services, payment options, and on identifying fake clinics is available on the NYC Department of Health's website. Professional organizations, individual providers, group providers, and hospital systems must be made aware of how to access information and be added as a provider resource listed on this page. The NYC Department of Health links to www.bookofchoices.org, a state directory of abortion providers, but only clinics and hospital-based programs are listed here. There is an opportunity to make this directory more accurate and robust by expanding the list of providers legally authorized to perform abortions, such as midwives. Expanding the abortion provider capacity should be prioritized ahead of, in anticipation of the influx of out-of-persons seeking care. NYC Health's abortion website must be made accessible and user-friendly to consumers in and out of state by featuring it on the NYC Health homepage, press releases, advertising, social media, and community-based organizations. Coordination by city and state Department of Health and city and state funded hospital systems is needed to make this comprehensive abortion care provider directory possible. New York Midwives supports the prudent use of the city's constrained fiscal resources, reducing redundancy and bolstering existing programs as part of Introduction 465. In order to have accessible, safe abortion care in New York City, it is imperative that individuals performing, aiding, or having abortions have legal protections. New York Midwives supports Introductions 466 and 475. New York Midwives supports Introduction 507, which addresses barriers to medication abortion, such as cost and accessible locations. Additionally, New York Midwives supports Resolutions 195, 196, 197, 200, and 245, which aim to increase the abortion workforce, solidify the city's pro-choice stance, and urge state and federal legislatures to protect abortion. In addition to expediting out-of-state midwives, New York Midwives suggests appealing to retired midwives to return to the workforce to provide telehealth medication abortion care. New York Midwives looks forward to collaborating with city and state to ensure accessible abortion care for all. Thank you for your time.
I want to thank you for hanging in here with us today. Really appreciate you, and thank you for all of the offering of insight. It's just a really powerful flag, making sure that we are including, midwives in the information that we're putting out. And you might not have this information on hand But just to sort of emphasize your point about there being, a whole nother part of the medical community that are meeting these needs. In this moment, do you have any numbers on sort of how many clients, midwives are serving throughout the state, and then on top of that, like, how many cases of abortion care midwives are providing around the state?
I don't have those exact numbers with me. I can try and provide them after the hearing. Midwives do make up a very small segment of obstetric care in the state. I do know at the H&H hospitals that provide abortion care, there are midwives doing that abortion care, both medication abortions and procedural abortions. Providing medication abortions is a lot more accessible for lots of reasons, including the training and that you can do it telehealth. Obviously, a procedural abortion you have to do in person and requires training as determined by the institution that you're performing them in.
Right, thank you. And then lastly, just thank you for the work that you do.
Of course, yeah. We're here and we're happy to help. It's, midwives and other advanced practice providers are legally allowed to provide abortion services in New York State. I'm speaking about midwives because I am a midwife and that's who I'm representing, but PAs and nurse practitioners can also provide care. So speaking to what the physicians were saying, there could be a reduction in training opportunities for providers, but there is also, there are resources to bolster the numbers of providers that can provide abortion care.
Great, thank you. And similar to what I said to the physicians is we would love to continue to be in conversations to make sure that we are leaving no stone unturned and filling the gaps.
Absolutely, we would love that.
Great, thank you.
Thank you.
Thank you so much for your testimony. We'll now move back to remote testimony on Zoom. As we call names, if there's anyone we inadvertently missed, as with remote testimony and remote hearings, hybrid hearings are the same. We will be checking at the end for anyone that we inadvertently missed or if somebody had to step away. Also, another reminder that you can submit written testimony and amend written testimony up to 72 hours after the hearing. There's no limit to written testimony. So I will call the members of panel 4. There will be 2 members, and then we will move to the 5th and final panel. But again, we'll be checking for anyone we missed. Panel 4 will be Samantha Scholar from the New York City Alliance Against Sexual Assault and Elizabeth Estra from the Latina Institute. So Samantha Scholar, if you are present, you may begin your testimony when the sergeant calls the clock.
Your time will begin.
Thank you. Good afternoon, Chair Caban and the members of the Committee for Women and Gender Equity. I want to thank you for convening this critical hearing to expand reproductive rights access in New York City and for allowing me to testify before you today. My name is Sam Scaller. I use she, they pronouns, and I am the Senior Campus Coordinator at the New York City Alliance Against Sexual Assault. The mission of the New York City Alliance Against Sexual Assault is to prevent sexual violence and reduce the harm it causes through public education, prevention programming, advocacy for survivors, and the pursuit of legal and policy changes. Over the last 7 years working in this field of sexual violence prevention, I've spoken with thousands of people who have had their bodily autonomy violated by a spouse, a partner, a stranger, a family member, an employer, a professor, or even a politician. The commonality amongst perpetrators of sexual violence is abusing power. Without informed consent, those perpetrating sexual violence combine their own power and the power they've taken to violate someone else's bodily autonomy. On June 24th, 2022, without the informed consent of the vast majority of Americans, the Supreme Court of the United States overturned Roe versus Wade, thus using their power to violate our bodily autonomy. Government institutions spanning from the Supreme Court to this elected body and everything in between should never replicate the actions of abusers. Eliminating protections for people seeking bodily autonomy after becoming pregnant for whatever reason is an example of an institution abusing its power to violate our bodies. While here in New York State and New York City, abortion access remains legal, we should not breathe easy. No matter where, reproductive violence is sexual violence. We at the New York City Alliance Against Sexual Assault know that sexual violence disproportionately impacts people holding historically marginalized identities and intersecting identities, gender diverse communities, ability diverse communities, Black and Brown communities, AAPI communities, Indigenous communities, and every intersection in between have not only historically been purposefully excluded from the state's bodily autonomy rulemaking, but have and will continue to experience sexual violence and reproductive violence at rates higher than that of their cisgender, able-bodied white counterparts. While there are no specific data points for New York City to quantify people's experiences with reproductive and sexual violation, we at the New York City Alliance Against Sexual Assault can qualitatively, anecdotally, and humanly argue that one instance of reproductive and sexual violation is too many. We urge the elected officials sitting here today to use the power and platform they have to take any measures necessary to ensure that despite the overturning of Roe versus Wade, that New York City will be a place for bodily autonomy, choice, and freedom. With that said, we'd like to share our immense support for this legislative package. As this committee continues to take action in strengthening access to abortion and reproductive health care, we ask that you consider expanding Introduction 0465 to very explicitly require all of DOH-MH annual reporting be anonymous as to not breach the confidentiality or identity of any patient seeking medical care. Thank you so much for your time today.
Thank you.
Thank you so much. And we have a slight change. So we actually, just because we have been losing people on Zoom and that are logging in and out, we will be checking for anybody that we missed or inadvertently missed. But we'll be adding 3 panelists to this panel, and then it will be the final panel for today. So the next 3 panelists on this panel are, again, apologies for any mispronunciations, is Mary Santiago from the Bronx Defenders, Eric Agario from the Korean American Family Service Center, KAFSC, and Winnie Yi, all above all. The next panelist is Maurice Santiago from Bronx Defenders. You may begin your testimony when the sergeant calls the clock.
Your time will begin.
Good afternoon, and thank you for the opportunity to testify today. My name is Isamara Santiago. My pronouns are she, her. I am a parent advocate supervisor and a Healthy Mothers, Healthy Babies advocate from the Bronx Defenders. Healthy Mothers, Healthy Babies is a program which provides targeted support to pregnant people at risk of losing their newborns to foster system. The Supreme Court's decision taking away our right to abortion is the most recent highly public strike against people's reproductive rights. The decision felt deeply personal to me because it affects the decisions women like me make for themselves. People like me who recently was so excited and wanted nothing more than to have a child with my partner was hit with the most terrifying news and difficult decision of my life. To terminate my pregnancy at 17 weeks because of a chromosome disorder of trisomy 18, which causes various abnormalities and a low risk of survival during pregnancy. The Supreme Court's decision was a huge hit to reproductive justice. But reproductive justice is not just about abortion. And for too long, abortion and contraception have been the focus without enough of a focus on the right to bear and raise children free from government's terror. As part of the Healthy Mothers, Healthy Babies project, I see firsthand how pregnant and parenting people rights are violated by the Administration for Children's Services through the Family Regulation System. The Family Regulation System, also known as the Child Welfare System, causes more harm than good, creates a stressful environment for birthing people during their pregnancy, violates their right to privacy, and threatens them with separation. This system mostly affects low-income Black and Latin parents. Birthing parents are often met with an aggressive and invasive investigation throughout their pregnancy, and only moments after their birth, the parent is asked to participate in a 2-hour or more meeting that is called a child safety conference, where ACS decides whether to separate the family and whether to bring a case to court. These conferences strip people of their reproductive right to parent and to parent freely. Parents in these communities Thank you, I'm wrapping up. Parents in these communities are over-policed and surveilled and are afraid to bear children, in large part because of ACS. Reproductive justice requires people to have the freedom and dignity to choose to not have children, to have children, and to parent freely. I urge the City Council to take steps to address how ACS threatens the reproductive rights of all New Yorkers. Thank you.
Thank you.
Thank you so much for your testimony. The next witness will be Eric Agario from the Korean American Family Service Center, KAFSC. You may begin your testimony when the sergeant calls the clock.
Your time will begin.
Thank you. Good afternoon. I would like to begin by thanking the committee and Chair Caban for the opportunity to testify today about the barriers survivors face in accessing services in New York City. My name is Eric Agarijo, and I am the Development and Communications Manager at the Korean American Family Service Center. KFSC is a leading nonprofit organization primarily serving Korean, Asian immigrant individuals and families affected by gender, race-based violence, including domestic violence, sexual assault, child abuse. KFSC provides culturally and linguistically comprehensive services in support of our clients, including counseling services, case management, transitional housing, economic empowerment programs, after-school programs, and other wraparound services. For over 33 years, KFSC has supported survivors who have experienced a history of violence, exploitation, and abuse that has directly or indirectly led to their involvement in our programs and services. We have a 24-hour bilingual hotline and an emergency shelter, which operates 24 hours a day, 7 days a week. 98% of our clients are immigrants, 98% are women, and 100% of our staff members are immigrants themselves or children of immigrant parents. 95% of our clients' first language is not English and come from low-income backgrounds. KFSC represents approximately 3,000 clients annually. In the work that we do, we provide direct services. We understand the following barriers our most vulnerable survivors face in accessing services: fear of retaliation by the partner, fear of deportation, incarceration, community isolation, discrimination, trauma, the lack of financial resources, language access and digital literacy, limited availability of linguistic and cultural accessible programs and approaches for those who wish for non-system approach to healing, housing costs, limited availability of affordable safe housing programs. This ties in with choice is the essence of freedom, the right
Time's
to vote,
expired.
the right for each of us to select our own paths to dream for our dreams, the right to choose how we would or would not live our lives. This is a direct assault on Asian American or AAPI community, people of color, especially individuals of low incomes and immigrants, where the path to abortion care is overwhelmed with language barriers and culture stigmas among our most vulnerable community members. And I'll just wrap up with this. KFSC recognizes the importance of exercising this very important right, this very choice that ensures not only that women enjoy reproductive autonomy, but the educational and economic benefits flowing from those rights. Once again, KFSC looks forward to working with the council, this committee, and our community partners to address these gaps. Thank you very much again.
Thank you.
Thank you for your testimony. We also have a small change to this panel. So we'll go to Winnie Yee next, and then the last and final final witness on this panel will be Elizabeth Estra. This is the panel and our final panel, but we will be checking again for anyone we inadvertently missed after our next panelist. So the next witness will be Winnie Yee. You may begin when the sergeant calls the clock.
Your time will begin.
Thank you to the chair and the committee for the opportunity to testify today. My name is Winnie Yee, and I'm with All the Ball. As a campaign that unites individuals and over 140 organizations across the country to build a future where abortion is affordable, available, and supported for anyone who needs it, All the Ball strongly supports Resolution 195 and Introduction 507, as well as the full package being considered today. In its decision last Friday, the Supreme Court destroyed the last shreds of our national right to abortion without concern for our dignity and basic human rights. The decision was the result of a decade-long scheme to dismantle access to abortion care and will have a disproportionate impact on people of color working to make ends meet who are already bearing the brunt of systemic racism, bans on abortion coverage like the Hyde Amendment, and the ongoing pandemic. The ripple effects of the ruling will be felt far and wide in every state, including here in New York, and that's why it's important that the New York City Council push for both solutions and approve Resolution 195 and Introduction 507. Resolution 195 would call on the New York State Legislature to pass and the governor to sign the Reproductive Freedom and Equity Program sponsored by Assemblymember Jessica Gonzalez-Rojas. Each of us should be able to make decisions about whether and when to become a parent, but abortion coverage bans and low wages can make it impossible for New Yorkers to pay for care. Thankfully, New York organizations like the New York Abortion Access Fund and the Bridget Alliance help people overcome financial and logistical barriers. The Reproductive Freedom and Equity Program would provide them much needed funding so they can continue to support people in making decisions about their health and futures with dignity and economic security. The second measure, Introduction 507, would make medication abortion available free of charge at city health centers, clinics, and other facilities. Medication abortion is a safe and effective option for ending an early pregnancy, and as mentioned earlier, a growing number of people who end their pregnancy are choosing medication abortion care. A report by the Guttmacher Institute found that it now accounts for more than half of all U.S. abortions. In the aftermath of the Supreme Court decision that will force people to delay their abortion care or carry an unwanted pregnancy against their will, we need bold solutions for abortion justice that would address the realities of getting an abortion in our country and break down the barriers for people working to make ends meet. Resolution 195 and Intro 507 are important proposals that will ensure abortion is there for everyone who needs it, without barriers based on who they are, where they're from, or how much they earn. I respectfully urge you to approve these measures, and thank you again for the opportunity to testify.
Thank you.
Thank you. Our final panelist, our final witness on this panel will be Elizabeth Estra from the Latina Institute. You may begin your testimony when the sergeant calls the clock.
Your time will begin.
Thank you so much. My name's Elizabeth Estrada. I think I might have cut my name off in the registration for the hearing. I'm the New York Field and Advocacy Manager at the Latina Institute for Reproductive Justice. I reside in the Northwest Bronx, and at the Latina Institute, we work with activists and leaders throughout New York City to inform, organize, and mobilize our communities on reproductive justice issues. I want to thank the City Council member Tiffany Caban for calling this important hearing, and the Committee of Women and Gender Equity, and all legislators who have introduced bills to support New Yorkers and anyone seeking care in our state in the light of the fall of Roe. As an immigrant woman who has had 2 abortions in my lifetime, I'm proud to live in a city that is taking bold action for reproductive freedom and abortion access at such a critical time. Thank you for hearing my testimony today. I want to remind us that even in a progressive state like New York, many Latinos and Black Indigenous people of color face the same hurdles to access healthcare that we see across the country. Although Medicaid does cover abortion in New York State, every day we see how many fellow New Yorkers are excluded and left behind. Some are struggling economically and are still not eligible for Medicaid. Some people need to keep their abortion private from a coercive partner or parent whose insurance coverage they share. At the Latina Institute, we often hear from undocumented immigrants who are scared to provide the personal information required on Medicaid applications for fear of exposing their immigration status. It remains clear that all families need access to essential health care, including abortion, not more economic barriers or obstacles due to their immigration status, race, gender, native language, or how much money they make. Abortion restrictions do not change the fact that everyone deserves access to quality care without stigma and barriers. In addition to the many barriers I just mentioned, folks often face when accessing much needed abortion care. Living in the Bronx, I often see protesters lining the sidewalks in droves, protesting outside reproductive health care clinics. I've worked in service to reproductive justice for over a decade and have seen firsthand how much violence, harassment, intimidation providers, advocates, clinic escorts, clinic staff, and patients face when entering reproductive health clinics. In my many years volunteering as a clinic escort, I can say firsthand that the presence of police at clinics is not helpful to stop the harassment by anti-abortion activists. Police only increase confusion and end up creating more fear in communities that are already facing over surveillance and harassment by police. Officers mostly spend their time scrolling on their phone during their shifts and rarely step in to support patients when harassed or even blocked from entering the clinics. The same people protesting these reproductive health care clinics are also the ones volunteering at crisis pregnancy centers to deceive and misinform those people seeking abortion care. This deeply impacts Latinxes and Black, Indigenous people of color disproportionately, specifically in the Bronx, since anti-abortion activists target our communities due to an assumed lack of understanding on the issue. That is why we call for the legislature to pass the Reproductive Freedom and Equity Fund, the Resolution 195 calling for the passage of the Reproductive Freedom and Equity Fund that Jessica Gonzalez Rojas introduced this year during the legislative session. This would create a program managed by the Department of Health, which would provide capacity building to providers, fund uncompensated care due to an individual's lack of coverage or inability to use health care, and address practical needs of patients. The practical needs that someone might have include air, ground, transportation, gas money, lodging, meals, childcare, translation, and doula support. The right to an abortion on paper without access is not one that translates into access of care. We believe that codifying this fund will help New York to truly position itself as the leader in access for reproductive rights and justice that it's committed to being. Let's allow the nation to see New York as leading in the path for full reproductive justice and self-determination by passing the Resolution 195 for the passage of the Reproductive Freedom and Equity Fund. In addition, I also want to support the passage of Intro 458 requiring the Department of Health and Mental Hygiene to maintain language access services for abortion providers, as well as the passage of Intro 507 requiring the Department of Health and Mental Hygiene to make mifepristone and misoprostol available free of charge at its healthcare centers and health stations, health clinics, and other healthcare facilities. At the Latina Institute, we will continue to empower our communities and lead the charge to ensure New Yorkers have full access to the range of reproductive care they need with dignity and respect, but we need the support of New York City and state legislators. Thank you for your time. I look forward to answering any of your questions.
Thank you so much. And I do have a question, but before I do that, just some brief comments. I want to, thank you all for your testimony, Ms. Scaler. I, wanted to make sure that you know that we are taking note of, the suggestion that you gave around expanding all the info being anonymous that's collected for Intro 465. Ms. Santiago, thank you for the work that you do at Bronx Defenders and for sharing your personal story. I just want to highlight and uplift, the point that you made about, this also being an issue around the right to bear and raise your children in an environment free from state violence, and certainly within an environment where the government is offering, adequate material supports for folks. And I want to thank Mr. Eric for uplifting the barriers that AAPI folks are experiencing, and Ms. Estrada to that end, uplifting the barriers that Latinx and immigrant folks, other immigrants are experiencing. But I do have a question for you that I also want to follow up with, because it's something that I was deeply concerned about when I heard it in the admin's testimony about, what does it mean to create a safe, what infrastructure, what pieces are in place to allow people to feel safe. And they mentioned partnership with the NYPD, which I found deeply concerning. And you stated, as I did, that the presence of police at clinics is often not helpful for a lot of different reasons, but I'm hoping that you can elaborate with a little bit of detail why that is. Can we unmute her?
If you can please use the raise hand function in Zoom, we can unmute you, and then you just have to accept the unmute. Apologies.
Okay, great. Thanks for your question. And while I've done clinic escorting in several states in Florida, Georgia, and New York, I can only speak to my experience in that the ineffectiveness of police presence at clinics looks like, in my experience, just a non-action. They are there to present a perception of safety, but don't actually intervene when patients are being harassed. And so I don't have any particular examples to share with you, but in the past, when I have done clinic escorting, like I stated in my testimony, often their presence is just them scrolling on their cell phones and not getting out of their vehicles.
And do you find at all that there are particular folks who simply don't find safety in their presence, not because of inaction, but because of who they are and how they have related to police in community?
Yeah, what I can say is that our community sees over surveillance, especially during the summer months, of NYPD officers in our own neighborhoods. And so often what will sometimes happen is we'll get questions from folks being driven to the clinic about what the police presence means. And sometimes folks feel intimidated just by their presence because there's already there's anti-abortion activists approaching people's vehicles. There's the clinic escorts approaching the other side of the vehicle, so that causes confusion. And then the presence of police just makes people feel uneasy and furthers the confusion.
Thank you. We're all set. Yeah, no, that's it.
Thank you so much. That concludes the public testimony portion. We will do one check for anyone we inadvertently missed, and we'll also be reading the names of those who registered for the hearing for the record, also just to check that they're not here. There might be some individuals who registered mistakenly for this hearing instead of another hearing happening at the same time, but we will read all the names. So if we did inadvertently miss you, if you can please use the raise hand function in Zoom. We'll check for any witnesses, and while we're waiting and checking for those hands, I will read the names of those that registered. Cassandra Gonzalez, Maria Mohammed Miller from Planned Parenthood, Kavita Mehra from Saki for South Asian Women, Deidre Sully from Public Health Solutions, Anthony Paris-Dickey, Dr. Sarah Feitel, Salma Mohammed from Arab American Family Support Center, Nirmala Padmatsu from the National Asian Pacific Women's Forum, Letitia McNeil, Chris Bennett, Diane Prashad. And again, we know that some people have submitted written testimony, but we are just doing a check to make sure we didn't miss anyone. We can also accept written testimony up to 72 hours after the hearing, and it can be sent to testimony@council.nyc.gov. Just doing one check for any hands. One moment, please. Okay. Okay, there is one more witness, Amita Ghosh. Apologies for missing you. You will be the final panelist, and you may begin your testimony when the sergeant calls the clock.
Time starts now.
Hi, thank you. My name is Mela Ghosh, and I'm the Health Policy Coordinator at CACF, the Coalition for Asian American Children's Families. Thank you very much, Chair Caban, for holding this hearing and providing this opportunity to testify. Founded in 1986, CACF is the nation's only pan-Asian children families advocacy organization and leads the fight for improved and equitable policies, systems, funding, and services to support those in need. Our country is currently facing an abortion access crisis, which will especially impact our most marginalized communities, including low-income, people of color, and immigrant folks. Cis women, non-binary, and trans folks from these communities deserve equal access to safe, affordable, comprehensive, and compassionate reproductive health care, which includes abortions. For abortion care to be truly compassionate, it must be linguistically accessible. This is why CACF is in full support of Speaker Adams' Intro Bill 0458 that would require DOHMH to maintain language access services for abortion providers. Language barriers are a huge obstacle to care faced by many folks in immigrant communities, especially in the AAPI community. In New York City, AAPIs have the highest rate of linguistic isolation of any group, as 46% have limited English proficiency, LEP, meaning that they speak English less than very well, according to a recent report from the New York City Department of Health and Mental Hygiene. Moreover, more than 2 in 3 Asian seniors in New York City are LEP, and approximately 49% of all immigrants are LEP. Language barriers can prevent folks from accessing vital reproductive health services, including abortion, an important component of public health. Despite there being 76 language access policies targeting healthcare settings in New York, many LEP patients still report facing difficulties like being unable to find an interpreter that speaks their dialect or being unable to fill out paperwork because the translated version in their language does not exist. A lack of linguistically accessible services in all forms of healthcare settings can have grave consequences. 50% of adverse events that occurred to LEP patients in U.S. hospitals were likely the result of communication errors, and nearly half of these events involved some physical harm. A recent Guttmacher Institute study found that API women make up a significant proportion of people who want and need abortion care in New York City. The study also highlighted that within the API community, Indian American women have the highest rates of abortion in New York City. Considering that many APIs seek abortion services and constitute for a significant portion of LEP persons in New York, it is critical that proper language access is for abortion providers. In addition to Speaker Adams' intro bill, we are also in support of the bills being introduced by Council Members Caban, Hanif, and Rivera. CACF strongly believes in reproductive justice for the API community alongside all marginalized communities. Thank you very much.
Thank you so much for your testimony.
Thank you so much. So we'll do one final check again for anybody that we inadvertently missed. If you can use the raise hand function in Zoom. And we are not seeing any hands in Zoom. We'll just give it one moment.
I have a short closing.
Oh, great.
Yeah.
Okay, this concludes we do not see any hands, so this concludes the public testimony portion of the hearing. One moment, please. Please hold. Apologies.
Okay.
We do not see any hands, so we will now move to a closing statement from the chair. Thank you.
Thank you. We received a ton of just really critical information, throughout this hearing, and just broadly speaking, I think that one thing that is abundantly clear is that in order to meet the moment that we are in and take care of the folks that are affected by this decision, it is going to take a vast, deep, broad infrastructure to fill the gaps. And so, I'm proud that our council is taking this up and trying to do just that. We've certainly heard some things that we're going to need to consider and incorporate and think about other ways that we can fill any additional gaps that we may find as we continue to review the testimony that we received in writing and the testimony that we heard today. I want to close by just saying that abortion bans are tools. They're tools to advance. Again, it's important to place this in a broader context in terms of what's being attacked and what's at stake. And they're tools to advance white supremacy and patriarchy, and serves to concentrate power and resources amongst a select few by oppressing a manufactured underclass of BIPOC folks, of immigrants, of queer, trans, and non-binary folks, of people with disabilities, and poor and working class folks, to name a few. And I think about Justice Thomas's concurring opinion and how all the rights that he threatened in that opinion, that they are also tools to advance white supremacy and patriarchy and further solidify that manufactured underclass of people mentioned above, and how it's the through line for all of what we're seeing this current court do. And I'd like to close with just some really insightful words and framing from Rabbi Danya Ruttenberg, who I think framed the battle over abortion rights so clearly, that it is about who gets autonomy over their body, who is granted access to health care they need, which citizens and denizens get rights, whose safety matters, who gets agency, who has power, who is in control, who decides what freedom is, who gets dignity, who gets wholeness, who decides, period, who is decided for. And her concluding truth is just as clear, that we do not have to accept those terms. This legislative package is a refusal to accept those terms, and this council will aggressively pursue protecting access to bodily autonomy and health care. And the information elicited here today is going to be critical in determining our success in doing just that. So thank you.
No,